Hey everyone, we'll just wait for a couple more minutes before we start. Hello, everyone. I'm Joffin Mathai, Program Manager at the Center for Social Impact and Philanthropy, and welcome to the second CSIP Research Conference. CSIP is India's first academic center for enabling philanthropy for greater social impact. The CSIP Research Conference is in its early days, and our goal is to create a space for sharing and engaging in theories and practices related to the field of philanthropy. Last year, in the first research conference, we looked at different forms of giving. This included an exploration of the philanthropic responses to COVID-19 pandemic, study of new and emerging forms of giving, as well as community-based giving. This year, under the theme Philanthropy and its Myriad Avatars, we invited abstracts for papers and posters that would help us expand the scope of our focus and understand philanthropy in different contexts and from different perspectives. A few selected presenters will discuss their work during the course of the conference. Towards the end, we will have an international panel of experts with a pulse on philanthropy and philanthropy research who will share their insights into the global landscape. I'd now like to invite Swati Shresth, Research Director at CSIP, for her welcome remarks. Just a second, I think Swati is facing some tech issues.
Hi, Joffin. Sorry, I can't hear you. Just give me a second. Can we have...
Wait.
No, it's audio mix. Yeah.
I've had to change your name because I think you're joining in from another system. Yeah. The floor is yours. So yeah.
All right. Welcome everyone to CSIP's second research conference on philanthropy, titled Philanthropy and its Myriad Avatars. This conference is part of our continuing pursuit to promote and support research on philanthropy in India. We hope this annual event will create an open space where rigorous conversations on philanthropy can take place. As an academic center, it is also our endeavor to challenge narratives that stop us from thinking imaginatively on what philanthropy could be, what its potentials is, and what its various avatars could look like. Philanthropy in today's world has come to mean certain things: formal, institutionalized forms based on modernity, rationality, and capable of promoting structural changes. However, if we go back a little bit in time, or a little bit more in time, to the root of the word, which means love for humanity, and then we shift our lens on the love part of it, we will see, we will recognize, and acknowledge that the love for humanity manifests itself in various forms. It has always done so, and it continues to do so, sometimes parallelly with whatever we understand as mainstream philanthropy. And that this giving and this love is deeply embedded in our psyches, our moralities, and in our cultures. Over the next few hours, we will hear from young scholars, senior scholars, and seasoned practitioners share their perspectives on what philanthropy is. We very much hope that spaces like this will promote deeper conversations on the nuances and complexity of this love for humanity that we are all very interested in. One of our focus areas in the center, therefore, is also to document and understand the diverse and enduring local traditions of giving, of caring, mutual aid, and second, building on this research and evidence to argue for more inclusive, nuanced categorizations of philanthropy. Indeed, this shift in how we study philanthropy is in response to the shift we see in how philanthropy is being reshaped globally. For instance, voices from the global south have urged a lot of global organizations that give internationally nudge them to reorient themselves, to stop, to think, and recalibrate their programs of working as well as their organizations. They have also conceptualized their program of work and what the relationships should be in the communities that they want to see their work making a difference. Similarly, old distinctions between charity and philanthropy also collapse when beyond we look beyond the established notions of philanthropy. The existing distinction is based on the assumption that charity is reactive, whereas philanthropy is proactive, and is no longer useful in understanding the place of giving in the overall well being of individuals and communities. For instance, our research on household giving informs us that understanding of religious motivation is often mistaken. Such giving is perceived as reactive, incapable of contributing to progress. What is often ignored is that people see places of worship also as places of doing good. They see the community kitchens, shelters for the poor, and free health camps as essential to their well being as well as the nation's well being. And this is not just an Indian phenomenon. This sort of understanding of nation, community, duty, and morality is seen in other countries as well. But these learnings have also come to us due to the incredible work being done by our research fellows in the past year. For context, CSIP hosts research fellows who are encouraged to further research in philanthropy. And over the last 2 years, we've had fellows do amazing, robust work. We have 21 papers which are on our website for everybody to refer to. And through their research, they have sensitized us to more rounded understanding of various kinds of giving. What are the motivations? What are the practices? What does sharing risks, gift exchanges, for example, mean for community building? And some of these practices and the motivations look very much like philanthropy, and yet they're never categorized as philanthropic, and they come outside the mainstream understanding of what philanthropy ought to be like. During this conference, we have a four current cohort of fellows who are going to talk about their work, and we hope that their contributions will continue to inform CSIP, its research agendas, and hopefully shift narratives, which is what academic research institutions are supposed to do, which is to innovate and shift narratives. I therefore ask Shalini, Kalyan, Amod, and Diksha to introduce themselves and talk a little bit more about their research. Over to you, Amod.
Thank you, Dr. Swati. It's an honor to be able to speak at this conference that is being organized by CSIP. I am the CSIP Research Fellow for 2023, and I'm doing my research on diversity, equity, and inclusion in the philanthropic organizations, in the grant-making philanthropic organizations in India. I'm primarily looking at domestic philanthropic organizations only. And the scope of my research extends to understanding how the values of diversity, equity, and inclusion are expressed by these organizations. That is what is their intent, and what does it contain, which is the content part of it. I'm also looking at what frameworks are they using, how are they defining and diversity, equity, and inclusion within their organizations. Then I'm also looking at the development. What specific measures do these organizations take to ensure that diversity does take place both at the level of recruitment, promotion, and also feedback levels, and also in terms of how inclusion is practiced and how the whole idea of equity is ensured, and there is the people who work in the organization do feel the value of equity being observed within the organization among themselves and by the organization as well. So, and I'm also, the way I'm looking at it is I'm the landscape I am defining in terms of the grant making organizations, the CSR's corporate social responsibility, both in the public sector and CSR in the private sector. I'm also looking at corporate trusts and also family philanthropies and also retail philanthropy. So I'm trying to make an assessment how each of these different forms of philanthropy that exist in the country are observing the diversity, equity, and inclusion within themselves. My focus is not on where they are spending their money, but right now the focus is on how they practice it within their own organizations. Thank you.
Diksha, would you like to talk about your work?
Yes, absolutely. Thank you, Swati. Good afternoon, everyone. My name is Diksha, and I'm a research fellow with the CSIP. So for my fellowship, I'm studying the role of community-based health actors in facilitating access to medical care for low-income urban communities. So with New Delhi as the field, I am researching with NGOs, volunteer groups, faith-based organization who act as critical partners in urban health, and I'm studying their role within the urban health landscape in a post-pandemic context. Other than this, I am also a doctoral scholar at the School of Social Work at the Tata Institute in Bombay, where my thesis is a study on internal mobilities for medical care in North India. And through an urban ethnographic lens, I study people's journeys to urban centers like Delhi, coming in the city as patients and caregivers looking for care in the city. And other than these, I'm also interested in interdisciplinary research on labor migration, urban poverty, civil society in the city, housing, and urban health. I am very happy to connect with the extended CSIP community through this conference. And hopefully I will get a chance to engage and collaborate with many of you in the future. So thank you so much. And I really look forward to the panels and discussions today. Thank you.
Alni, I see you there. Would you like to talk about your work?
Sure, Swati. Thank you so much. Hello, everyone. Nice meeting you all. I'm Shalini. I'm from Hyderabad. My background is in sociology, and I finished my PhD from University of Hyderabad. So right now, as a part of the CSIP fellowship, I am exploring philanthropy and social justice movements, basically the patterns and impacts of funding social justice movements. And I think with the little experience of being in nonprofits and also being a part of few movements that I was really interested in understanding, and exploring this question of, what are the different ways in which social justice movements have been funded in India, and, how does funding actually impact the movement, both from a point of view of the funders, but also in terms of the collectives and the movements that receive funding, and also like what are the different opportunities and challenges again from both the funding of actually funding social justice movements in India. And I'm trying to do this qualitative study using focus group discussions and in-depth interviews, again from the point of view of the movements and basically the collectives and the movements who who have been participating in the movements, but also from the funders' point of view of the organizations and who are actually funding the movements, and what are their opportunities and challenges, and how does this go from both ends. So I think I'm really I've already started a part of it, and I find that it's been a very interesting journey, and I'm very, very happy looking to engage with the discussions, but also I really hope that a lot of participants here would also be someone really interested in that question. I'd be more than happy to connect. So thank you so much.
Kalyan?
Hi, Swati. Thank you. Good afternoon, everyone. My name is Kalyan Shankar, and I work as assistant professor at the Symbiosis School of Economics in Pune. And I'm delighted to have this opportunity to discuss about my research project with CSIP. As part of the cohort of fellow CSIP 2023 fellows, I'm working on the role played by sex worker organizations in helping their members tide over the COVID-19 pandemic through fundraising and provision of food and other essentials. Now, there's already some literature on how sex workers were among the segments of informal labor worst affected by the pandemic, and they experienced a sudden loss of clientele and a fairly severe fall in incomes. And moreover, adding to the vulnerabilities, the lockdowns continued much longer for them, given that they were under surveillance as potential carriers of the virus. Now, in this backdrop, the role played by the organizations working with sex workers assumes relevance. And my study seeks to fill this gap and shed more light on the subject. Now, going beyond individual organizations, I'm working closely with a meta structure or a meta organization called the National Network of Sex Workers. And it comprises of over 70 organizations as of date, and they are spread across 9 states in India, and with a collective membership of close to 1 lakh sex workers. And this strength and membership has expanded greatly after the onset of COVID-19, largely because of the interventions of the network on the field. And now, with reference to the National Network of Sex Workers, I'm looking at many tiers of funding, 5 tiers of funding and relief assistance here. So the first tier is of global funding, and as part of a broader coalition of key population groups of HIV, the national network corresponded with the Global Fund for AIDS, Tuberculosis, for fighting AIDS, tuberculosis, and malaria, GFATM, and they were able to secure a collective funding of close to $10 million. However, the utilization of this money was a problem, and I'm looking at some of the challenges therein. The second tier of funding came through from central and state governments, and it was largely because of the advocacy of the network. And 2 states in particular, Maharashtra and West Bengal, had specific schemes for providing relief assistance for sex workers. Again, this didn't quite come through, and and many sex workers did get excluded out of them. So again, there's an attempt to understand some of the problems of accessing or availing funding. The third tier of funding that I'm looking at is from philanthropic organizations and CSR initiatives, which have always supported individual organizations, but haven't quite transitioned to supporting the network at large. The fourth tier is from crowdfunding sources and individuals. And lastly, I'm also looking at the ways in which the national network managed to raise or channel funds internally. So the national network actually comprises of a set of regional groups and how they were able to regionally support member organizations. So I believe that collectively these 5 tiers provide a mapping of the funding scenario experienced by sex work organizations during COVID-19 and the challenges therein. I'll stop here, but I'll be happy to address any questions you may have. Also, I'll type out my mail and contact details in case you would want to reach out to me. Yeah. Thank you.
All right. Thank you so much to the research fellows, and thank you, Swati, for your welcome note. For our first presentation, we have 2 presentations that will engage with the theme of family philanthropy. I'm just trying to keep a note of who all have joined. Yeah. The discussant and moderator for this session is Urvi Sriram, who leads the Center for Philanthropy for Inclusive Development, CPID, at the Indian School of Development Management. Our first presentation is a special presentation by Neemat Sidani, a PhD candidate and teaching assistant at the Faculty of Social Sciences and Solvay Business School of the Vrije Universiteit Brussels. Is Neemat around? Has she joined in yet?
I don't see. I am messaging her. Why don't we go with the other presentation and join?
Right. So we have Ami and Prachi. Are you guys here?
Hi, I'm here. Ami is
Great.
just joining in a minute.
Great. So I think you can go in first. So our second presentation will be the first presentation, and it will be by Ami Misra and Prachi Pal. Ami Misra anchors the research and insights vertical at Dasra, while Prachi Pal is part of the philanthropy labs at Dasra. Over to you, Ami and Prachi.
Thanks, Jofin. We'll just, if we can just wait a second for Ami to join in. And that's when we can begin with the presentation. I hope that's all right.
Do you want to maybe share your screen? I mean, if you're presenting anything, maybe that's something you can test out.
Yeah, Ami's just come on.
All
So
right,
that's
great.
great. We can take it on from here.
Hi. So sorry, my Zoom just updated at the wrong time. I'm really
It's
sorry.
okay. Happens. Yeah. So we've already made the introduction, Sami. So you and Prachi can go ahead with your presentation. We can't hear you. You're on mute.
Ami, you're on mute.
You just want us to like share the screen, right?
Yeah, share the screen and do your presentation. Yeah. I think we can probably follow your work better.
Okay. Just a second. Could you please allow screen sharing? Okay. So we'll just begin. Yeah. All right. So thank you for hearing us out on our ongoing research on family philanthropy. Prachi and I work on philanthropy mainstreaming research at Dasra. We both worked on a couple of the India philanthropy reports during our time at Dasra. And over the last year or two, we've started to notice some trends on the heterogeneity within family philanthropy. And we're here today to present to you some of our early and emerging research within the space. We're very, very mindful of the fact that we operate as an intermediary within the philanthropy ecosystem. So we just want to clarify that that is definitely going to be a limitation of our research, that we actually come from that bias as intermediaries. However, we've tried our best to try and triangulate some of our findings with sector experts to provide a more comprehensive view. And given that this is early and emerging insights, we are very open to your feedback so that we can actually strengthen the narrative that we have here. I'll pause here and pass it on to Prachi to begin the presentation.
Thanks, Ami. So before I start with the leftmost side of the slide to walk you through the quantitative trends that we've been seeing over the last couple of years, I want to highlight that what we define family philanthropy as is that it comprises of three unique cohorts. The first one being the ultra high net worth individuals. And we've defined them as folks whose net worth is beyond over and above 1,000 crores. Along with HNIs, high net worth individuals whose net worth ranges between 200 to 1,000 crores. And then there's the affluent layer, which is net worth of 7 to 200 crores. So all three of these combined make up how we've defined family philanthropy. Over the last 13, 14 years, we've been partnering with Bain & Company, and we released what's called the India Philanthropy Report, which is one of our flagship publications and one of the only data sources on philanthropy, particularly family philanthropy as well. And what we've identified through the quantitative mathematical model that we update year on year with the help of Bain and Company's team, is that family philanthropy remains the key to bridging the social sector funding deficit in India. The social sector funding deficit is quite large, or to which the public sector contributes the most at this point. But given that we are a developing economy, that's not something the public sector can continue doing, right? Also, given that there are different types of capital within the philanthropy landscape in India, we have CSR, we have retail, as well as family philanthropy. What we've identified through our conversations, through the giving patterns and behaviors that we've noted, is that family philanthropy is the most flexible form of funding. Therefore, it's uniquely positioned to be the key to unlock more funding for social sector deficit in India. As well as over the last 5 years, we've seen that family philanthropy has grown at a decent moderate pace, which is 12%, and has reached $3.6 billion, as you can see on the graph on the leftmost side of the slide. The future projections also show that between HNIs and affluent, as well as UHNIs, there's between 11 to 17% of annual growth rate that's been anticipated through the mathematical model that we have. And some of this has also been corroborated with the conversations we've been having with sector experts, be it private wealth managers or philanthropists themselves, or other foundation heads that we continue speaking to. The purpose of our curiosity and the research is largely that there's very limited research on philanthropy in India. Family philanthropy being a lot more niche and nuanced, there's very limited understanding of giving behaviors and giving patterns, especially given that family philanthropy itself is very heterogeneous. We have HNIs, UHNIs, as well as affluent givers. Each of these cohorts have different giving patterns and behaviors, and we've taken a crack at slicing and dicing some of that data to see what are those unique trends that we are seeing across each of these cohorts, which together make up family philanthropy. And also because there's a greater need to unlock a lot more capital that is needed to be pulled into the Indian social sector for us to be able to, as an economy, as a country, achieve or go closer to achieving the UN SDGs that we have a target for. Towards doing this research, we've tried to focus on a mixed methods, which I'll come to. But broadly, the research questions that we're trying to answer through the ongoing efforts that we have year on year, be it through publications of the India Philanthropy Report or through an ongoing research effort we're making to understand professional givers in the Indian landscape, is that what social determinants make family philanthropy a heterogeneous group, and how do these determinants actually influence giving behaviors across each of these cohorts which make up family philanthropy. And to answer these questions, we have a mixed methods methodology, which is basically involving semi-structured interviews with sector experts, funders, civil society practitioners, NGO leaders, wealth managers, family philanthropy advisors, intermediaries, other players in the ecosystem who are able to help us with giving us the nuances from what they've been seeing, but also helping us validate some of this quantitative data that we gather year on year and present in the India Philanthropy Report. What makes the last year's report quite unique, and the coming year, reports in the few years also something that we're able to add primary data to, is the fact that we last year we launched this network called Giving Pie. It's India's first family philanthropy focused network, which has over 250 families. So we were able to add a first cut of primary data by funders self-reporting that data, and our team having one-to-one conversations with funders to understand their giving behaviors better. So we were able to actually validate some of the trends that we've been seeing with some of the conversations and primary data that we had for about 50 plus families last year. And this year we've tried to expand our data set to over 100 families as part of our methodology. I'll hand over to Ami to present the results, which are at the moment interim, and once again do want to acknowledge that we do understand that we do practitioner research. It will have a few biases because we continue to work with funders and we have conversations with them, but any feedback would be most welcome for us to deepen the rigor that we want to have in our philanthropy research. Ami, over to you.
Thank you, Prachi. So we've divided the results into 3 sections. And today we are not going specifically into the trends, right? We are only sharing the typology of the results. The trends is something that we do cover in the India Philanthropy report. So anybody who's interested in seeing how these results actually pan out as trends, you can read the India Philanthropy report to find some of that. So the first result that we would like to share with you is with regard to how family philanthropy is notably heterogeneous through a diversity of determinants that contribute to its categorization, right? So one of the first categorizations that we have here is origin of wealth. The second that we have is quantum of wealth. And the third that we have is other identities. With regard to origin of wealth, we have the source of wealth, such as whether the funders are self-made, generational wealth creators, or whether they are professionals or entrepreneurs. With regard to quantum of wealth, it's really divided based on the amount of wealth that they have. So basically, if you see, these are publicly available through whether they are UHNIs, HNIs, etc. And we largely show that.
Apologies, I think Ami is having an internet issue at her end and is just joining back in like a minute.
Sure.
Hi, I'm so sorry. My internet went off. Just a bad day for me and Zoom. All right. Yeah. So coming back to it. So basically, quantum of wealth is information that is publicly available based on whether the funders are UHNIs, HNIs, or affluent givers, which basically, just to sort of decode that, it's ultra high net worth individuals, high net worth individuals based on the amount of wealth they have generated. And then finally, we have other identities like gender, geographies, whether people belong to tier 1 cities, tier 2 cities, whether they are from marginalized communities, whether they belong to the diaspora and they are giving to India. So these are some of the categories that we have created. The second result that we would like to share with you is with regard to the mode of giving, right? Which basically depends on the operation strategy that the philanthropists are using. Some of the key ways in which we are seeing philanthropists operate is through own and operate foundations, where they are actually directly involved in program implementation and they're not necessarily involving civil society organizations, but are actually working with civil society practitioners, hiring them and creating this sort of direct delivery mode. The second structure that we see in this case is through individual donations, where, families are just giving money based on their personal motivations and liquidity without a very formal structure. So they just provide a grant based on the liquidity that is available to them at a given point in time. Then we have grant-making trusts, which if you see the history of family philanthropy, we have a lot of these charitable trusts that have existed for the mohalla or for the community from the very beginning, right? So you'll see a lot of the public infrastructure that we have in and around us, whether it is, a simple water cooler that you would see in the olden days around in cities, to actually more systematic institutions such as hospitals, educations, etc. So there could be grant-making trusts that are actually providing these kind of infrastructures within the community. And finally, the fourth kind of categorization we have here is institutional family foundations. Again, we've had a very long history of these. where there is a direct involvement of the family member in the governance of it. And they are sort of operating at a scale which is very, very large. And they are actually able to mobilize civil society organizations, even run a few programs on their own. And there is a lot of actual intentional effort that goes into running an institutional family foundation. The third part of our result actually links to some of the trends we observed from a very small data set of around 50 members last year, where we try to look at what is the rationale for why people give, right? And we sort of codified it into these 4 rationales, which links to nurturing community resilience, which for us is linked to just the survival of the community, right? Like improving the immediate needs of the community. The second kind of code that we had over here was with regard to building the capacity and scale at which nonprofits operate. So this basically refers to operational excellence, service delivery, and it stems from a belief that there are individuals who are change agents. There are organizations that are doing phenomenal work, and people just want to support those organizations and individuals. The third rationale that we had was with regard to strengthening of the philanthropy infrastructure. Now, this is more strategic kind of giving, which is focused on research and innovation, strengthening partnerships for giving, and also building a better ecosystem so that other funders actually come on board. And then finally, the final rationale that we had was fulfilling personal giving motivations, which is linked to the value system and the lived experiences that a lot of the family philanthropy families already come with, right? So this could also be linked to the samaj, that the community and other sort of social determinants actually influence individuals. This is basically the key results that we wanted to share with you. And we're trying to report trends based on the ways in which we have sliced some of this data. I'll just hand it over to Prachi to sort of conclude for us.
Thanks, Ami. So through all of these conversations and the data, what we've come to understand is that family philanthropic capital, given that it's flexible, it has a lot more freedom compared to other forms of capital, such as CSR, is a lot more flexible, has a particularly important as well as a unique role to play. It can actually be a catalyst which can sit at the intersection of government, of private players, and really play an important role in strengthening the infrastructure to make giving easy, whether it be to strengthen through research or through innovation, like Ami mentioned towards when she explained about strengthening philanthropy infrastructure. So that's the kind of role that family philanthropy can play in making domestic giving in India a lot more effective, a lot more disruptive, be it adopting innovative methodologies or trying newer approaches, for it to be a lot more experimental in nature, be a learning lab, be okay with some failures, and be able to shift focus to causes which are underserved by really taking the lead, and then being able to shift where funding in India needs to go by being the first people to actually do that, because there's that uniqueness and that flexibility and that risk-taking ability that family philanthropic capital actually has, is what we are seeing. And to even deepen further rigor in our research, we're very curious to understand and build on some of the cuts that we've taken through some of the other questions that we have, which we want to leave you with, which are that what are those correlations between different cohorts of givers and their approaches, right? And how does this affect the work of civil society? Because ultimately it's all about the communities that philanthropy is trying to serve, right? And how can research on family philanthropy be a lot more strengthened, a lot more nuanced, and actually aid decision making for philanthropy and also build sectoral intelligence? And these are some of the areas that we'd love to delve deeper into, double click into, and really understand those by strengthening research on family philanthropy in India in particular. With that, I'd like to wrap up. Thank you so much for being patient listeners, and we welcome any questions that you all may have.
Thank you, Prachi and Ami. We'll move on to the second presentation before Urvi can discuss both your works, and then we can take on more questions as well. So Our presentation by Neemat Sidani is a special presentation on a book chapter that she recently contributed. Welcome, Neemat. She's a PhD candidate and teaching assistant at the Faculty of Social Sciences and Solvay Business School of the Vrije Universiteit Brussels. Over to you, Neemat.
Hello. Hi, everyone. Hi, Jopien. Thank you for hosting me. Many thanks for Professor Swati for inviting me as well. I'm very sorry about the hassle, but there was something wrong in the Zoom, I think, a Zoom application, and yeah, so that delayed a little bit. So first of all, I'm very happy to hear about the philanthropy and what's going on in the sector in India, especially family philanthropy. That was really very insightful presentation. Thank you, Prachi and Ami. And my presentation is a little bit similar, but I'm not targeting or researching family. This is how the family philanthropy, I would say, is shaped in Lebanon. And my study, maybe I would share my screen. Just let me know if you see the presentation, the slides.
Yes, we can, Neemat.
Yeah, I will try my best to be also very quick. I don't know if you are viewing my screen.
We can view the folder.
Okay, then I need to
the
do
file.
Yeah.
Can't see it opened up.
Now, maybe. Can you see my screen?
No, I think you need to change the view of your screen.
I did.
The one that you're sharing.
Sorry?
We can still see your folder. We cannot see the file that you opened up. So you did probably change the, Maybe you can share your entire screen and probably to share the presentation as well.
Maybe like that.
Yes.
Now you can see it?
Yes.
Okay. So this is the famous picture of the Beirut port explosion and the casualties that happened. And that was actually my trigger to the research, the entry point to the research.
We cannot see the next slide. Have you moved on to the next slide?
No, not yet. Not yet.
Okay, all right.
So I'm just showing the angels going in the sky.
We cannot see that view. I think that's the second slide, right? We still can.
Okay, so maybe I will just one moment. Can I do it like that?
Yes.
Okay, maybe it's better. So the entry point of my research was the explosion at the port of Beirut in 2020. And in fact, the country had been bombarded with other crises in the same year in a very short period of time, starting from the financial crisis in the end of 2019, then the COVID pandemic in March, and then the explosion after a few months at the port. And all this created a really immense societal crisis. And what I noticed was phenomenological, is the help of the family firms through their philanthropic practices, which are actually which go back way before any crisis. So it's like a legacy in Lebanon for family firms to practice philanthropy in their local community for many years ago. So this is how the research started. And I wanted to study how this role of family firms has grown in light of the crisis. So in this exogenous shock, and how did they practice their philanthropy? Did it change? Did they continue the same? What happened? Of course, my research starts with a literature review. So basically, this is the I would say the title or the purpose of the book chapter. it's about addressing the how question. So how did it happen? How did they practice? What changed? What challenges they faced? In this case, I had to read two bodies of literature on family business and philanthropy, because actually the family business literature alone does not really tackle the subject of philanthropy by itself. And if you also look at the philanthropy literature, it doesn't tackle family business philanthropy. And as also the presenters before me said, that family philanthropy is also a niche topic. So it's really under-researched. And this is what I found in the literature, and this is how I identified my gaps. So there are gaps in the paucity of the research, in definitional, a lack of consensus, I would say, among scholars, and also the element of the stakeholder relationship between the family firm and its stakeholders. So when it comes to philanthropy, there are specific stakeholders, which are the beneficiaries or targeted stakeholders for philanthropy, that are different from the normal business stakeholders like suppliers, customers, etc. So this is in fact also niche, and it's worth researching, like it's worth further researching. So when I looked at the theories as well, I found that there is a lot of diverse theories used in the literature or among scholars to try to explain this phenomena. And the most widely used theory is the institutional theory. However, this theory is not like alone, it remains lagging. So it really needs to be integrated with other theories. Some of them are traditional, like the stewardship theory. So when you say philanthropy, most of the researchers directly think of stewardship and how companies want to be good stewards in their society, so on and so forth. And then I thought that, okay, but stewardship is not enough. I need to address the really concrete relationships between the beneficiaries of the giving and the family firm itself. So this is why in this book chapter, I focused on the stakeholder theory. And I identified the stakeholders of philanthropy of the family firm. So I'm trying to be as brief as possible because I know I don't have a lot of time. My methodology was, first I adopted the qualitative research. I highly salute and appreciate the mixed methods because I think it's very important to this field. And we don't have a lot of mixed methods, as well as we don't have a lot of qualitative research in this regard. So it's like a nascent field, and anything that you add is good. For me, I chose qualitative because I'm doing a multiple case study. And in fact, after an exogenous shock or a crisis, you really want to go on the ground and interview people and translate their stories. So storytelling in such events is really very important. And that's why I chose 9 family business cases, which I know they are quite immersed in philanthropy or philanthropic practice in Lebanon. And they are really very well reputed in the local business market. And I interviewed 24 people from these cases, between managers, family owners, non-family members, and employees. I used, of course, the abductive approach because there is this surprising element, the exogenous shock, and therefore there are new dynamics in the field that need to be looked at. What else for the methodology? Yeah, so it was for, again, 2 years. So I did 2 rounds of interviews, and I coded them based on NVivo and Excel. So I did like 3 coding levels to be able to get my final themes. So in the book chapter, of course, it is more elaborated on. But what I found in brief that we have 4 interconnected findings. The first one is that indeed the crisis altered the normal philanthropic practice of the family firm. However, it did not trigger this practice. So we did not see new family businesses constructing a foundation, for example, or philanthropic initiative in order to respond to societal needs. So the only people at the business level. So I'm talking about at the corporate level, not at individual, because at individual it was a completely different dynamic. But at the business level, and also mentioning that family firms constitute around 90% of the business sector in Lebanon. So most businesses are family businesses. And therefore, they continued their giving, but in different dynamics. So some of them extended more of the same program, I would say. Others tried to shift their target stakeholders, so tried to prioritize stakeholders. And this priority element was really quite evident. It was very clear that in the crisis context, the stakeholders have changed. So some businesses said, okay, now we have to focus on the smaller circle, only our employees. Also, this is because of their maybe resources, maybe they were in the geographical location where the explosion happened. So they were also, part of their assets was destructed. Others, it was the contrary. They mentioned, okay, we used to do only philanthropic programs on education, for example, but now this is not the need. We need to respond to the situational urgency, to the societal need at this moment. So they changed their stakeholders. Some family firms I interviewed, they just donated for anybody who was affected in the crisis. Others, they again prioritized based on the needs. So that was one important finding. The second one is that the family firms were really quite agile in responding to this need, even before the intervention of the state or the government or even other NGOs. So that was also phenomenal, and it shows how this actor should be more recognized in the field. And again, here there's another important or interesting finding, which is the collaboration with the NGOs. So because of their networks, because of the networks of the family business owners, some external or international NGOs intervened to give support to the people. Some of them, they actually donated to international NGOs. For example, they donated to the Red Cross in Lebanon, but it's still an international organization. They donated, for example, their warehouses. So it's not only a donation of money, it's a donation of in-kind donations, assets, for example. And another also interesting sub-finding, I would say, in the collaboration with NGOs is the element of trust. So the element of trust was really quite valued in times of crisis. And this trust shaped actually the way the relationships with stakeholders, whether they were the beneficiaries of the giving or NGOs, for example, changed. So some interviewees told me that now if you want to donate, we prefer to donate to the NGO that we know. to the NGO that we back, for example. That was also an important observation. And yeah, lastly is the change in the perceptions of the meaning of the community. And here comes, for example, the element of religion, the element of local community, how you define your local community. Is it the people from the same sect? Is it the people from only your district, your neighborhood, or maybe your community is, again, the victims or the families of the victims of the crisis itself. So these different interactions and different dynamics really create, as also my colleagues mentioned, a nuanced view on philanthropy in general and on family business philanthropy, or the role of family businesses in philanthropy in specific. So these were basically my findings. And again, this is only specific to the book chapter that I wrote. Of course, here I'm contributing to the literature of crisis management, to family business philanthropy, and to other third sector literatures. Again, what I found is, as in the family business literature, you don't have really a consensus on the definition of what is a family firm. And this also affects, if you want to define what is family firm philanthropy. Is it family philanthropy alone? Is it corporate philanthropy? What is it exactly? And what's the role of the various elements, stakeholders, resources, etc. So as managerial implications, I would say we can advise or encourage practitioners to look at these at their philanthropic strategies, to be more proactive in times of crisis, and to know how to prioritize their stakeholders based on what they have as resources and even based on their values. And again, there is an agile role of family firms in the philanthropy or the third sector field, although this type of corporation lies at the boundaries of business logic and family or also social logic. And lastly, a key takeaway or a learning takeaway from a diverted context, I would say, or a crisis context is the creativity in philanthropy. So parts of what I found is that the philanthropic activities by themselves have changed, or new forms of philanthropy have emerged, more entrepreneurial philanthropy, more socio-emotional or psychological philanthropy, like, for example, one of the, and maybe I would end with that, one of the family owners told me, okay, I don't have enough money to donate as before because our money was stuck in the bank due to the financial crisis. And again, we were hit with the COVID. So what I can do is to motivate my employees. And this is my philanthropy in these times. My philanthropy is to sit with my employees, to dedicate time to their well-being, to engage them, or to brainstorm projects with them that we could do after the pandemic, for example. So this way he continued to engage his employees, and this way they felt productive, and they could continue to survive in this whole environment. So this is basically what the book chapter is about. It is now in its publishing phase with the Routledge handbook. And I hope I will see it in 2024 and will be able to share it with you. Again, the book chapter is written with my co-author. So he's my professor at the VUB. And yeah, I will be happy to share it with you once it's published. Thank you very much for the time, and I am open to any questions. From the audience.
Thank you, Nimat. Thank you for that. Uri, please take the lead. We do have time.
Thank you. Thank you so much to CSIP for inviting me here, and to everyone who's joined us for this very interesting discussion. Ami and Prachi, thank you for those, valuable insights into the importance of family philanthropy, the diverse ways in which donors are investing in social impact, and, the social determinants behind the who, what, how, and why behind, the funding decisions of families. Really can't wait to see the final complete report. Niyamat, it was actually very interesting to get a glimpse of how family firms in Lebanon do philanthropy, how they foster relationships with the nonprofits, and how they prioritize their stakeholders. Thank you for that very interesting.
Thank you for giving me the time to present it and to listen to my presentation.
Yeah, each country, of course, has its unique sets of issues, drivers, motivations, but at some level, some of these dilemmas are so common to the philanthropy sector across the globe. So it's quite interesting to see that. Over the last 2 years, we at the Center for Philanthropy for Inclusive Development, we've been trying to understand the philanthropic landscape in India, and particularly trying to figure out what role is philanthropy playing in elevating the marginalized communities, supporting some of the underserved areas, and really addressing the root causes of social issues. So like your study also concludes, Prachi and Ami, there's definitely this, widespread agreement that there's a huge need and opportunity for private philanthropy, and specifically family philanthropy, to really drive large-scale social change. And it's not so much because of the, financial weight, which remains marginal compared to the enormous challenges, but exactly as you said, Prachi, because of its independence, its ability to take risks, and really support what markets and governments may not be, able to do. And yet somehow, whatever limited data is available, whatever, we've read in terms of all the reports published by B Industra, all of our interviews with various philanthropists, intermediaries, advisors, we see that philanthropy's role is really held back, often by a lack of data, some sort of aversion to risk, lot of geographical and sector biases. For instance, time-honored missions like education and healthcare, they continue to hold, a special place for most families. And at times, it's also just because of the internal operating structures and leadership of, the family-run philanthropic organizations. And while we understand that, every donor will have their own preferences, whether about select causes, geographies, or certain fixed approaches, but at an aggregate level, what is missed is that, these tighter and stricter donor preferences and boundaries give lesser autonomy and flexibility to the non-profit partners to really respond to the communities, to test new approaches, to innovate, and to add new layers such as gender, such as social justice, etc. And that's what seems to be happening, at least in India. A lot of the data, a lot of the giving is mostly, directed towards more easily measurable techno-managerial programs, and really addressing the symptoms of poverty rather than the structural issues. So we have very less time, but I want to actually ask both, Prachi, Ami, and Niyamat that, out of the 52 families that you studied, Prachi, Ami, and, the 9 families that you studied, Niyamat, do you see any kind of correlations between different cohorts of givers in terms of, people who have generational wealth, or people who are, from a professional background, or entrepreneurs, in terms of their approach to risk-taking? Are there any differences? Are people, for example, with, long-term family legacies, are they more open to risk-taking, or do they stick to traditional areas? Are entrepreneurs more open to risk-taking? Any sort of those insights would be really helpful. And if not, then any insights into what holds them back, really?
So I can begin, and Prachi, please feel free to add. Based on our research last year, so we had a very small sample size, right, Urvi? And this year we are planning to expand the sample size to 100. So we'll have clearer insights on what the trends are like. but we called it pockets of the future. Because, this is a trend that's beginning to develop, and it may not have developed fully, but we see a generational shift with regard to people who are from the now generation, which means that people who are first generation wealth creators, they could be professionals, they could be business owners, but they're first generation wealth creators. And the second category that we called out was intergen givers. So folks who've had generational wealth, but have had the lived experience of actually existing with some of the, cascading crises that we're seeing unfold in the present day context. So a very good example of this would be like a Raj Mariwala, who has begun something like the Mariwala Health Initiative, which is phenomenal in its intersectional approach towards mental health. So we've cited some of these examples as good practices, and we see this as a trend to stay. Now, only the future will tell us whether this will actually be a trend that stays, but there are definitely some early and emerging promising things that we're seeing develop, at least in the Indian philanthropy landscape. And I think the work that intermediaries do, the work that some of the academic institutions do, or the work that you are doing at ISDM, I think this can really help play a role in actually shaping the narratives in the same way. Because one of the key barriers is the lack of awareness. So if you continue to operate the way the previous generation has operated, which is focusing on health and education, then you may not see some of the overlapping challenges that exist with health and education. For instance, the issue of intersectionality, the issue of social justice, social protection. So once the understanding of philanthropists builds up on some of these issues is when they sort of stray away from the traditional approaches of just funding a particular sector without thinking about it with those layers in.
Thanks, Ami. Just to quickly add to that, we also saw Urvi COVID as an inflection point, right? Where we saw that folks entered philanthropy a lot earlier in their careers than they would have eventually done so. And given that they have newer businesses, they're a lot more tech savvy, entrepreneurial in their approaches, in the way they've generated wealth, be it through the fintech spaces or some of the other spaces. They're likely to borrow some of those approaches and leverage those in their philanthropic decision making as well, compared to some of the other traditional approaches. So, be it funding newer sectors, be it engaging with philanthropic advisors much earlier in their giving journey, or taking riskier bets is something that we're seeing as emerging. But like Ami said, we're calling them pockets of the future, and we're hoping that that's going to be holding through as the years go by. Yeah.
Yeah, maybe I can add also to that. I totally agree with the generational difference, because what I observed from my study is that the people who had a long legacy in practicing philanthropy, if I want to see at the founder level what happens at the managerial level, which are like the second generation or the more younger people in the firm, I observed that the founders who used to, again, target only education or healthcare and donate in cash were a bit hesitant or reluctant or risk averse in such a crisis about their money. While given all the risk, you see the young owners trying to be proactive, rushing to help the people with all the capacities that they have in order to first sustain their business, so to survive themselves, as well as to continue their business growing. And they had kind of faith, I would say, which also affects their or triggers this risk-taking that they have faith that tomorrow will be better, and together in collaboration. So collaboration was really important across the sector in Lebanon, as well as across stakeholders. So in collaboration with NGOs, with friends, with partners outside the country, we are able to survive and bypass this crisis. So that was the the vibe from the younger generation. Entrepreneurial philanthropy was really at the top of the way they bypassed the crisis, I would say, or a solution to mitigate the impacts of the crisis. This is one thing. Another thing I would say, I'm not sure if it's kind of related to risk taking or risk averse, maybe, but the values, the family values were really very important and a big motivation for those families to continue in their giving. So yeah, this is, and maybe the trust factor also emerges from these values because people trust those family firms. So it's a dual relationship. It's not only from the family firm trusting the stakeholders, but also the stakeholders trusted in the family businesses. And this is how they manage to continue their philanthropic practices and to get help from other stakeholders. So I think the family values are really very crucial to study, or they are really a crucial motivator to continue philanthropy.
Thank you so much. I think we're out of time, right, Jofin? Sorry.
we have 3 minutes, Survi. That will allow us a 5-minute break. But yeah, I mean, I'll leave it up to you. We have 3 minutes in case you have any comments. I think that'd be great.
No, I think just really interesting. I did have 1 or 2 more questions, but I'll reach out to them again. Maybe we want to take up something from the audience.
Yeah, that'd be good. Yeah.
People have been typing their questions, but in case somebody wants to, come on and ask a question. Yeah.
So the attendees can raise their hand in case there's any questions, or you can also put it in the Q&A. I don't think we have any. Do you want to ask a question, Urvi? You had a couple.
I think one of the main questions as an intermediary knowledge-based organization was, what if any of you in your research have come across what kind of support do family philanthropists, especially the next generation or now gen philanthropists, what do they really want in terms of data research or platforms or technology support? Like, what is it that, intermediaries can really do? And same way in terms of, reducing the trust deficit between nonprofits and, the philanthropic sector, what role can they play? I think it's more for Prachi and Ami in terms of, the situation in India.
Sure, and this is coming from a place of learned knowledge. Like, we've just been talking to experts and we're just replaying back what we've heard. One of the things that we've heard is that the intermediary ecosystem actually links well with a certain size of giver. But for a lot of the people who are newer entrants from the middle layer, the affluent and HNI cohort, there's no defined intermediary cohort that's actually addressing some of their needs. So then they turn to wealth managers and, like private equity firms who sort of provide this service in a very ancillary way. So I think there is definitely one gap there with regard to the number of intermediaries. We definitely feel the more the merrier. So, I mean, we do need those support organizations to grow. And then I think the other thing is that who do philanthropists listen to, right? They sort of listen to their own networks. They sort of move in the same circles. So there is also a need for stewardship and championship from within those circles. So if intermediaries can also sort of proliferate through those networks and actually use circles of influence to get that message out, that's also something that could be a potential gap area. And then, for instance, in the West, there is a real culture around giving and the importance of philanthropy. Like, there is a certain pride that comes with giving. So creating a little bit of that narrative and the fact that it doesn't exist in the media with that intensity is also something that we see as a gap. Like till a few years ago, we would also struggle to put out stories on philanthropy in the media. So this is clearly a gap in terms of public interest in philanthropy too. Yeah. But Prachi, please add if I've missed anything.
I'm afraid we don't have a lot of time. I'm just going to quickly go to Nimat just to take a question that's come in the Q&A. So there's a question by Amod. Did the family philanthropies adopt methods where they were able to move fast and provide fund at short notice? In such case, who did and how was due diligence done before funds were transferred? And
I'm not sure if I heard the second part of the question, but yeah, they were quite proactive, and this is what triggered actually my research, because we found this filling the gap, I would say. We found this quick support from family firms to local NGOs, as well as collaboration with the institutions, I would say, the public institutions that are that had to be on the ground, like the firefighting, for example, people, or the crisis relief institution. So I don't know if this is what they are asking, but yeah, indeed, it was quite proactive, and again, entrepreneurship was really important. So this quick creativity, quick entrepreneurial activity, leveraging on their relations, on their networking, was really very important. So whether it is a local network or international network, friends, expats, that they know that they directly donated to the family businesses, again, because they trusted in the family owners, for example, and they knew that, okay, this family owner would take the money and would really do something about it, which is correct and trusted. So the money would really reach the beneficiaries, or he might also use part of his, for example, if I have a business in painting or in construction, then this money would really help this person who has the expertise to help the people whose homes or houses were destructed. Because he has the expertise, he needed some extra resources. Okay, we trust him, we gave him this, and he did what he had to do, and he sent back reports or images of what he did. So transparency was very important, and this is exactly what happened. So now if you go back to the scene where the explosion happened, for example, you would see a completely renovated street, the main street that was hit, in a very, maybe in less than 2 years. So now we are at the doors of 2024, but that street or that area was almost finished, like the facade and everything, in 2023. So in really a very quick time, the family owners or the people who really had the resources, made efficient use of the time. So I hope I answered the question.
That's fine. Thanks, Lorna. That's all the time we have for this session today. But thank you so much, Ami, Prachi, Nimat, and Urbi, for taking out time and engaging in this very important discussion at this juncture. There are questions that people have asked, so feel free to kind of answer those questions in the chat box as well. We shall move on to the next session, which is on methodology and pedagogy in philanthropy. So for our next session, we have 2 presentations that will shed some light on methodological and pedagogical aspects of grappling with philanthropy. The discussant for this session is Dr. Abhishek Bhatti, Director of the Asian Studies Program and an Associate Professor in Political Science at Bowling Green State University. Our first presentation is by Andrea Pineda, PhD in Public Administration and Government from Fundação Getúlio Vargas from Sao Paulo, Brazil. Andrea, you can go ahead.
Thank you. Hi, good morning or good afternoon. Depends where we are. Could you listen to me well?
Yes, we can hear you well.
Yeah. Yes, okay. Sorry, because my camera sometimes closes. I don't know why, but I will try to stay open. I will share my presentation, okay? Okay. Could you see?
Yes, yes.
10 minutes, 10 minutes, really joking. I have 10 minutes, right?
Yeah. You
Okay.
have 12 minutes.
So, okay. Thank you. My name is Andrea. I'm from Brazil. I live in São Paulo. That is the biggest city in Brazil. And I am a PhD in public administration and government. Here, I finished my PhD this year, last month. And I had my degree in applied linguistics. And nowadays, I'm researching in a Center of Studies of Public Administration and Government in the same institution, the Fundação Getúlio Vargas. And I am a member from the International Society for Third Sector Research, especially for our local network. We have a Latin American network from the ICR. And I have many interests. I'm very interested in the relationship between the relations in civil society with the government and other topics that are related with this, like uncivil society, especially studies about educational policies, about the diversity, the value of diversity. And specifically in my PhD, my research was about the equity concept, because I don't know if you know, but Brazil is one of the most unequal countries in the world. We have many natural riches. We are very rich, but we are very unequal, and it's our most problem, social problem, economics problem. There is many problems. So a recent report from the World Inequality Lab shows that the 10% richest Brazilians receive around 60 of the national income. So the riches are very concentrated and there are many poor people. This photo is here in my city in São Paulo. There was a very poor community beside a very rich building. So in this context, in this so difficult context, the philanthropy is very important and a very important factor to our society. And we have the philanthropy here in Brazil since the colonization of Brazil, the Portuguese colonization. And in my PhD study, it's very similar to previous debated, because I investigated a specific group in philanthropy that here in Brazil is a very localized concept, but we call the private social investment. And that is the philanthropy from families and corporates. That is very similar, like our colleague told. The limits are what is family, what's corporate is very near. So I investigated this group in his relationship with the government. And I observed it in the last 20 years ago, the last 2 decades. So I tried to do an analysis in 3 levels analysis. Sorry, because the the panel is in Portuguese, but the picture is in Portuguese. But I try to show the orange line is the public policies in education, and the blue one is like the discourse of this group change about the equity changed during the years, during these 2 decades. So I did my corpora was 26 interviews and public documents too, and institutional tests. And I analyzed, I decided that was most important moments that I used the concept of critical moments in the educational public policy, Brazilian educational public policies. And I was in my analysis discussing all the time with an historical description, the involvement of these groups, and ended in dialogue with my theoretical framework. So my theoretical framework was some concepts from public policies about Theodore Lowy, and in connection with the three-dimensional perspective from Nancy Fraser. Nancy Fraser is a feminist North American academic, and her theory was about that the redistribution, it's important to think policies, to think equality concepts. She knows that the redistribution is important, but the recognition and the representation is important too. So I tried to observe this lens, this idea in public educational, Brazilian educational public policies. And dialogue with your panel here, your session, to the methodological framework, I created some analytical categories to construct an intrinsic case study about the Brazilian philanthropy, this group, the corporate and family philanthropy, the investment, social private investment. And I used a historical, longitudinal, and procedural approach from Langley. And my analysis lens was the historical perspective of critical discourse analysis, because this is what I tried to put here. In the different presence, in the different political contexts, the policies, the change of the policies, why each educational policy was created, and the discourse as the discourse changed in this period. It was very few, 20 years ago. It was the idea, the concept of equality isn't in the discourse, and it was growing up in the last 20 years. Because this, I think my research was innovated. It was different to my context, to Brazilian academic words, especially because 3 factors. The first of all, because there are few studies about this, specifically these sectors in the Brazilian academics, the private social investors, especially from a constructive perspective. We have many studies, especially from the educational courses, but always criticizing this group, always defending that only the bureaucracy, only government, they argue that the policy is only interested to people from the government. The other actors doesn't help, that doesn't collaborated with the government, with public policies, public discussions, and I disagree. Second, because there is a gap of studies in public administration about the philanthropy. Usually here in Brazil, the philanthropy was, especially the corporate philanthropy, family philanthropy, was studied in the business school, not from the public administration, always in the business administration. And in the third set point, dialoguing with this panel, because I choose a methodology about the discourse. I didn't observe it a specific company, a specific foundation, or a philanthropist or the richest guy from Brazil. No, I observed the discourse, the changes in discourse in this period. And only to, I think it's important to talk too, that another gap that I show here in, not only in Brazil, but in Latin American academic, that I would like to continue investigating in the future, what is the colonial perspective. There is some studies from Banerjee and from to Indian doctors, Survi Banerjee and Urvi Shirman and Banerjee. Sorry if I don't speak very well, but her studies is about the colonial perspective in philanthropy that needs to focus on historically marginalized groups that defends that they need to value the internal diversity and transparency, and the founders need to trust in process without control. And I think this idea make many senses in Brazilian context, the philanthropy in general, not especially with these groups, with corporate and family philanthropy, but not only. I think this idea is starting to studies here, but there is a gap in these studies. Could be a new space to studies, a new field. So thank you. I'm open to questions and other comments. Thanks.
Thank you, Andrea. We will move to the next presentation, and then maybe Abhishek, you can have the discussion. The second presentation is by Madiha Nisar, who is currently a PhD research scholar, currently associated with the School of Development Studies, TES, Mumbai. Madiha, over to you.
Thank you so much, Jofin, for the kind introduction. Hello, everybody. I'm Madiha, and I'm currently a research scholar based in TIS. My research is based with the Gujar women who constitute the nomadic tribes in Chhattisgarh, Kashmir. I'll be sharing the screen, and from there on, I'll take. Just give me 2 minutes. Is the screen visible? Like,
not yet.
I think I shared the screen. Does it?
Thank you, Abhishek.
Yeah. Madhya, just let me know and I can scroll through it. So whenever you.
I'm very sorry that I've not been able to share the screen. I really apologize. Yeah. So, okay. You can go to the introduction. So, okay. Through this research, the paper seeks to disaggregate the various forms of women's givings from their experiences, listening to each other and providing help to each other often provides ease and well-being. This is a line which I often heard in experience in my research while I was based in the field. This line set the tonality of framing women's experiences from Gujar women's everyday lives and relationalities, giving of time, reassurances, skills, sharing of food, labor, circulates giving as a form of prosperity and abundance in their households and lives. Women's relationalities with each other, essentially located in vulnerabilities, presence, at times friendship and solidarity for each other, pivots giving through the lens of connection with well-being as happiness and satisfaction, taking cue from Sapphire and Taylor and Karen McCallum. Also, further extrapolating giving through non-monetary help is a process of a shared endeavor where relationalities are placed as experiences of meaning making in giving and receiving care, taking cue from G. Martin. I am taking cue from two experiences to disaggregate women's relationalities as expressions of giving. In one instance, I was sitting with the women in a non-purposive conversation, and in another incident, an episode of miscarriage where all women came together to provide ease and help to a woman who was suffering from a miscarriage. These two, I'm taking examples from these two experiences from my field work to look at the thematic analysis of giving as bonding, unregulated giving, taking a cue from Erica Bornstein as a relational aspect, not one bound under a social contract or one thought of as an instrumental social action. It taking cue from an understanding of a free gift along with the recognition of flexible nature of giving as a means of helping and honoring relationalities with each other, which takes us to the understanding of a possible transformation of women's lives where Gujar women are possible enablers and change makers of their lives in their own right. In the entire process of my research work is heavily reliant on feminist ethnography research, which is based on the three-pronged concept of reflexivity. Reflexivity places me in the subject position of a privileged researcher, and I'm very sorry, I got a bit nervous due to the screen problem. Reflexivity places me in context of the researched relation, where researcher is also subject to my own experiences and meaning making in understanding the relation with the researched, and to extrapolate the relationship of sequencing women's experiences and care and giving in everyday listening, taking cues from experiences of not just verbatim but gestures of caring, gestures of belonging with each other, where informal conversations were very important to understand how ease, how laughter, how conversations of everyday framed various forms of giving, and also how giving creates an interpersonal bonding, interpersonal relationality of bonding, reciprocal relations and care with each other. Also, at times creates women's solidarity in women's lives for each other because they face oppression and systemic exclusion at various layers. So this pushes us to frame an alternative conceptualization of giving, which is not essentially based on a monetarized set of help, but rather a relational set of which is based in a relational setup as a reassurance of ease, caring, being, and belonging, where experiences are the pivot of extrapolate of are a pivot of understanding women's giving of assistance, labor, and ease, often uh, which often do not fall in the realm of the time-space frame. It is not also an unchanging frame. It is fraught with disagreements, negotiations with the norms, and where women often dreamt of how women could create a change if they listened and took care of each other. So it's an essentially a space where we women often thought of how we could take care of each other and how we could create a space of holding for each other through various forms of giving. And it essentially, when I am placed there, I was often asked this question: will you come back and help me if I need you? You come as a researcher to write your book and you will go back. We have to stay here and negotiate. When you come here, do look from our relational point of view. So it set me back to reflect on the question of relationalities from their point of view, from Guju women's worldview and life ways, and often to think of their ways of giving and not to just think of them as mere recipients of a benefit of some kind of a benefit or some kind of monetized help. Though I did go there as an exit. When I go and exit, I exit as a privileged researcher. My research method is always to be near the field in such a way that I do not create harm to women's presence and their everyday lives. Moving with the women in their everyday work in their domestic work was how I extrapolated the understanding of experiences, and that's how my methodology spanned in understanding their givings. So and that's how I locate researchers' experiences, meaning making an analysis of experiences in ethnographic study and looking at knowledge not as a removed and an objective one, but one which is created through a cohort process, and where the lived experiences and giving is rooted in women's lives and practices of every day, and it is replete in sharing of food with each other, regardless of their socioeconomic capital. Often they told me, we do not let anyone go unnoticed who comes to our door knocking for help. So it was a very dynamic space and a very changing space. Often when anyone would come to a woman seeking some time for childcare or seeking help because they had no one to look after them, or going to access healthcare because it was not located in an urban terrain. The terrain was such that accessing healthcare, accessing education, or getting awareness about any new scheme is often takes time. So that kind of holding, that kind of experiencing with each other and listening and moving with women with each other is often a bounded relation which helps women in their every day as a sort of a friendship and solidarity to live and negotiate the everyday of oppression and strict communitarian norms, where their access to life and decision making is very altered. And it really kind of pushes us to think about giving in a very alternative and a very unconventional setup as a kind of a free gift, which is based on an interpersonal relationship, not essentially which would be based on such relation that if I help you in a bounded relation, you're bound to help me back. It's often a way of helping, because it is a way of their life that I am helping you, because it's because the experience of helping is embedded in their everyday relational matrix, and also stems from the Gujar philosophy of life of helping, giving, and seeking assistance with each other, where others' well-being, the longing for each other's well-being is the priority, and a consolation for the self. That's the embedded context in the women's space with each other. It's not to create a romanticized representation that every day women would make a choice or decision to help each other, but a representation of their lived experiences to reflect their socially situated position and produce a rich and a textured knowledge, which is a changing dynamic and is fraught with often differentiations, internalized hierarchies, and norms of patriarchies. And the attempt through this paper is to rethink ways of giving from a Gujar women's point of view and worldview, to essentially produce and contribute to an alternative forms of rethinking knowledge and forms of giving.
Thank you so much, Madiha.
Thank you. I'm very sorry I got
No,
to
it's completely fine. We've been having tech issues. It's not just money. Okay. Thank you, Abhishek, for sharing the screen. Over to you to continue with the discussion.
Yeah, thank you to Andrea and to Madia to share this wonderful presentations, really insightful. I hope everyone can hear me okay. I myself had some technological problems, including like the last minute the electricity left. So that kind of undermines how difficult it is to do research when we're struggling with basics. So I really value your time here. I think you both research kind of cut through several interesting points, both of politics, also of class, marginalization, especially in Madia's case of also using a feminist lens. So I just kind of wanted to broadly open it up, right? To both of you, why did you decide to use a particular research method to answer your research questions? And also, how do you see yourself as your identity when you're studying a particular topic, right? So for you, Andrea, you're a Brazilian yourself. I presume you're from Sao Paulo, and you're studying issues which are affecting your community. For Madia, you are from that area, kind of really looking at, Gujar women, really marginalized section. So how do you place? So why did you decide to go for a particular research topic? And how do you place yourself within that research? Because fundamentally, a lot of researchers argue about subjectivity, right? You want to distance yourself from the topic to be objective about the topic, but you're placing yourself in the topic to entrench, to understand the struggles of the people, to really understand philanthropy, and also deconstruct this notion, which is a recurring theme in our conference around, is that it's not only the big money, it's not only the rich philanthropists, it's actually communities coming together to help each other, and often very informal, right? Just the love for the mankind, right? Going back to the Swati's point, right? Just want to help each other, and it's not just about money. Sometimes it's just about actually lending an ear. And also for the audience, if you have any questions, please type in. We'd love to integrate a discussion here, but I just want to mute myself. Andrea, I'll start with you first, and then I'll go to Madia.
Okay, thank you for the question, Abhishek. Sorry, I don't know say the names. So actually my research, I investigated the advocacy of this group in the government. Here in Brazil, our policy, we are very open. As our constitution was created, Brazilian policies is very open to other actors to create it together, to formulate the policies together. The civil society was a very important actor in this case, as we have many councils about public policies, especially this government, like nowadays Lula's government and others more progressive governments are very open to these actors. But it was there was many studies about these other actors in the policy, especially the communities, the civil society, more the basis civil society, not, and this group, this specific group of the corporates, philanthropies, the institutions, corporate families, institutions, very rich families, institutions. They always they have been studied very criticizing, like they don't have a value, they don't have importance, they only have the interest, the economic interest to make policies to stay together, the government. I'm not ingenuous. I'm not a very how can I say? I know that there is an interest. I know that these groups have a very important economic importance, very economic power, very political power. They have many political power, but I think that there was a space to study them, and they, if you agree or not, they are together, the government, they are doing policies, they are influence the policy. So I answering your question, I show that what's important is study his discourse, because it was changing. I wasn't interested to see, to study as his discourse, as they constructed the discourse to make incidents in policies. So in my work, in my thesis, I showed this. They use some discursive strategies to do these changes in policies. For example, nowadays and the last years, there was a discursive structure about the evidences. So here in Brazil, we talk a lot. You need to make policies based on evidences. You need to be science evidences to do a health policy. You make science evidences to do social policies, to transfer money to communities. Okay, it's everybody agree about this, but this group make evidence, constructed the evidence. This group uses some strategies to pay academics, to pay research, to construct evidences. A very, very practical example. Until some years ago, 5 years ago, we doesn't have a curriculum, a national curriculum, because my research is always in educational topics. We doesn't have a national curriculum. The teachers in the basic school can teach what they want. Usually the companies to create the books, the editors makes the line, the orientation that what will be teaching in the schools. So 5 years ago, 4 years ago, I don't know, maybe 5 years ago, this group organized and started to mobilize and an advocacy lobbying to that Brazilian needs a national curriculum, like many countries in the world. So they invited specialists from Australia, from United States, from UK, to discussing with Brazilian academics the importance of creating a curriculum, how this curriculum could be constructed, what was the best practice, like this. And nowadays we have a national curriculum. So they do evidence, this constructed this evidence, they created the public space to discussion, they sway with the minister, they stay with the councils. So in my thesis, I try to show like this discourses involved to result in a new public, in a new policy, sorry, to construct a policies. So I believe that it was important thing, important public thing, that public changed, and nobody was watching this. Nobody was investigating this, only investigating, criticize. Look, they are not a relevant actor. They don't have legitimacy to discussing this. Don't care. They are doing. they legitimate or not, they doing. So let's study how this happened, why this happened, what was the discourse together these movements. So I don't know if I answered.
Yes, you did. Thank you. Madhya, what was some of the, why did you decide to go for this particular research methodology? And how do you place yourself while you're studying your research topic?
Yeah. So while looking at the question of experiences as method and way, and looking at the question of how experiences are placed in the span of anthropological and ethnographic works. So feminist looking at feminist ethnography became an important cue while I was placing myself in the field, and while I was interacting, and while I interact with a kind of representation of Gujar women. So while looking at culture as a space of order and meanings and differences and transformation, so it becomes a very important cue to look at the constant relation and conversation between the researcher and researched, and also looking at how writing ethnographic field notes is a conversation of intimacy and involving participation in the daily lives of people. So I am taking cue from experiences, which is often a dilemma that I face while I contextualize it in context of theory, because experience can often be dismissed as merely an opinion, or what is so glorious about an experience of giving, for instance, or an experience of being in a non-monetized form, or in a vulnerable setting, which informs and can inform theory and can be understood as knowledge, when usually we understand tribals as as backward, who need development, or who need our voice, and who need to be lent our voices to be represented. So this is a constant dilemma that I grappled with while I chose my research methodology. So my research methodology has been a continuous participation and moving with the women in their daily lives. At times I would call it participant observation. At times I participated in their daily activities to sort of frame and understand experiences of every day, and to then sort of to put it in a thematic analysis of feminism. And it has been a journey which has been fraught with, at times, the difficulties I face is how do I contextualize feminism? How do I deal with the language of coloniality, translation, and how do I frame a possible decolonial ways of thinking and a just and ethical representation of Gujar women's worldview, which is not just my perspective of choosing. Though yes, I do agree that the texts I choose, the language I choose, is doesn't it does come from my subject location and my positionality, and I'm not, denying that bias there. But the methodology largely has been uh, a critical ethnography, which is informed by by a long participation in the daily lives of the women, to sort of understand their experiences and how they map the everyday, how everyday sequences to the complexity of relationalities, and that sort of really how those relationalities map into the larger and broader spectrum of understanding community, society, and women's a women's community, or a women's group with each other, and it's a changing and a dynamic field, which is not sort of against a blank slate. I do come with, for instance, a concept of feminism, but that doesn't mean that it's not it's devoid of it's devoid and an objective theory. It is constantly enriched by the experiences and local traditions and language of women. So at times I do not function monolingually in my research. I function in a lot of translation work. So at times I'm translating from Urdu Gojri to English. So at times there are 3 levels of translations that happen in my research methodology to sort of form and to sort of form meaning making and constantly locating experience as a method and as a feminist intervention in understanding ways and contributing to knowledge and to rethinking ways of doing research methodology.
Yeah, and absolutely, I agree. I mean, I don't think I think it could be seen as bias from a more quantitative side of view, but like, for a critical work to do, you have to really entrench yourself into the experience and understand that experience, to articulate that experience. And then, the kind of hard work it goes into, like you're translating into 3 languages, coding and creating a meaning and giving the meaning some kind of kind of giving a voice to the voiceless in a way, right? And often a lot of the research is Eurocentric in that experience. So it kind of so I really value that kind of work. So thank you for doing that work for both of you. So I just wanted to kind of broaden this a little bit more to think about, like, for researchers who are interested in the topic. So first of all, what challenges did you experience while doing this kind of work? And also what potential challenges people could experience if they're interested in doing the work in your area. So a little bit more about, so for instance, I would imagine the gatekeeper to be one challenge. The other issue really I empathize with is, often when you look at the data set, you can say, okay, 10 million people are living under $1. But to talk to 10 million people to see what it means to live under $1 is a very different experience. So, when we're working on big data, or big data not by like AI sense, but like just the data, you're distant. But when you're talking to people, you're experiencing, the various form of repression and marginalization is a very different experience. So so broadly, like, what were some of the challenges you experienced yourself? What would potentially advice would you give to researchers who are interested in doing the work you have been doing? And I think we have about 6 minutes. I will also throw in my second question there. What are some key takeaways from your research? Things which surprised you, things which didn't surprise you? Will you do the same kind of work again?
Okay, I don't know if I understand all the question, but so I think my contribution, I hope so, my contribution is to make reflections in this group for future publics. And I think I chose this methodology to do a register what's happened in the past, because the last Brazilian government was very different, the ideological difference, word of view, very different. Bolsonaro was extremely right. The Lula's government was extremely other sides. So my idea was do the register what's happened, and to reflect it for the future, the importance of because we have moments more dialogue with different actors in the public policies, and other moments more closely. So I try to, with this methodology, make this register and shows that when the public space was closed, it's not a good idea. We didn't do the best policies in this period. And not make a more equity changes. We for the opposite, we growing the inequality in the spirit. The inequality growing in the spirit. So I think this historical critical approach that I chose shows the moments more best for the population, and the others that was not a good idea, not a good decision. I think it's this.
Question to you. Do you want me to repeat it? Potential challenges you felt, key takeaways, other things you want to share about your research? And if others, I will also give a shout out. If your audience have the question, now is the time to ask.
I think the challenge, like the challenge that sort of stays with me mostly is the task of translation. And how do I translate another life world into one language, English? Like that has been one of the challenging factors. And another challenge that at times I faced was the vulnerability of being a woman researcher. I embodied corruption to the women where I went. So I, as a woman, I never felt that I could be, a source of corruption to the women there. So that was a huge challenge that I have faced in my research. And the key takeaway and what sort of like I would like, if anybody is interested in researching with tribal communities, it's a wonderful opportunity. It's anywhere. Like I have researched with 2 different tribal communities in very different contexts and settings. It's just that we need to probably go there and listen. I mean, that it sets the our worldview, our understanding of temporality, life, giving, belonging, and being in very different setups. And it could possibly inform our understanding of policy making and access to education, healthcare in a more inclusive way if we have more stakeholders and voices from the community. So I think that's like those are the 2 key takeaways that sort of have been with me for a very, very long time. So I thought that, yeah.
So, Swati, you have a question.
I don't have a question. I have an observation or a comment, particularly for Madiha. There's this new concept that's doing rounds in Europe, relational philanthropy. And I just feel that, work like this actually gives a new meaning to what relational philanthropy is. It's about relationships, right? And people having more agency, having more stake, it being more of a conversation. And I do think that it's looking at things like giving in a slightly different way that we can also contribute to these emerging ideas in philanthropy. Because again, the fear of even using terms like relation philanthropy is that they get very entrenched and they lose the fluidity. So I just think it's very good to inform an emerging concept about this kind of work that is happening. That's also a philanthropy and is relational philanthropy. So very interesting, Madiha, just an observation.
Thank you, Swati. I totally agree. Other questions, thoughts? Well, I can keep going asking questions, but I can keep it flowing.
Absolutely, Abhishek. I think you can take questions, but you can maybe expand on something else that you would want to shed light on.
I just wanted to thank you, both Andrea and Madia, for your work. I think that personally, to me, it's so important because it kind of deconstructs where the most of the knowledge comes from, either the US and also Europe related to philanthropy. And we often think of big money as one of the driving factors, which is important. But I also think that the discourse to which philanthropy is operating in the political environment, and that how political environment changes over a period of time, especially in the case of Brazil, in which it's not that much institutionalized. And it's so similar to India and maybe other developing countries where so much of income inequality exists on it. You just, so it's so relevant.
I think we probably lost Abhishek for a bit.
I know that Abhishek is here in India visiting family, and he's flummoxed by the fact that power goes off. So I think what's happened for him is that power has gone off, and we'll have to wait for a bit before he can hotspot himself. But I think we're sort of nearing a break or the next session. In any case, should we just move on to that? Just can't hear you, Jochen.
Oh, sorry. I mean, we are close to the next session, and we also have the panelists here. Maybe just wait for a minute because I think he was
finishing a thought. Yes, he was
finishing a thought. So I think it's we do have time, so we just maybe try and finish that thought. We can take any questions from attendees, panelists, anyone who has a question. Or if Andrea, you have a question for Madiha, or Madiha, you have a question for Andrea as researchers. What did you find interesting about the work that the other is doing? I think that's also worth learning from. All right, I'm not sure if power is going to come anytime soon, wherever Abhishek is. So I think we will move on to the next session. But thank you so much, Andrea and Madiha, for sharing your work with us and really helping us think about these issues, especially both from a methodological perspective and also from a pedagogical perspective. Really expanding, the limits that some of us may have in terms of how do we think about these topics. So thank you so much for sharing. We also thank Abhishek for having a very fruitful discussion with the both of you. So for our third session, we have two presentations under the theme of philanthropy in uncertain times. Our presenters for this session are Dwell Jayakishan, Senior Manager, Partnerships and Communications at the nonprofit Youth for Unity and Voluntary Action, YUVA, and Ketki Purohit and Khyati Dharamshi from the Center for Asian Philanthropy, India. Ketki is Center Head at CAPI, and Khyati is a Research Associate at CAPI. We're delighted to have Gautam John, the CEO of Rohini Nilekani Philanthropies, who will be the discussant and moderator. Over to you, Gautam. Can take the lead from here.
Thanks so much, Jochen, and it was really lovely to listen in on the previous session, and I'm just really delighted to be here. Today's today's conversation on the session titled Philanthropy in Uncertain Times, we've heard a lot, but the ones that I'm moderating and I'm really looking forward to are about the diverse facets of Indian philanthropy responding to two particular kinds of systemic issues of inequality and exclusion. Personally, the philanthropy that I work at has focused on some of these issues for over 3 decades and has sought transformative change in what was discussed in the previous session on relational philanthropy with, not for, by working with civil society groups on the ground and in research and in convenings. And our fundamental values are around humility, trust, collaboration, and patience. I'm really looking forward to the two presentations and our discussion today on the role philanthropy can play in these uncertain times, upholding foundational constitutional values of justice, dignity, and enabling marginalized groups to access their rights. I believe Doel is going first, and my sense is you have 5 minutes. Doel, was that it?
10, Gautam, Jofin?
Yes, you have more time.
Oh, all right. Sorry, I
No
wasn't
worries.
first. I was just checking on that. Over to you, Doel. Thank you.
Okay, I'll just share my screen. Just a second. Yes, I hope you all can see it. Great. Okay. Thanks so much, Jofin, and thank you, Gautam. Very, very excited to be here today, really, and to share a recently concluded research that I've been working on, which looks at Indian philanthropy supporting justice and rights work that nonprofits are doing. So without losing any more time, just give me, yeah. So just to sort of locate ourselves where we are, and we are talking about philanthropy in uncertain times. We are looking at India, a country where increasingly there's been a slide down many important global world rankings. We are looking at some regulatory changes that have come about that have possibly impacted funding. And we are also considering a sector, private philanthropy, where there is a lot of potential for growth, but it's also important to look at what are the areas and what are the spaces where giving has increased. We do have the recent CSIP report, which does talk about how religious giving has really spiked, but giving towards secular organizations, and I understand these are different forms of giving. It's just to, locate ourselves where we are. So really within the emerging polycrisis, civil society, and within that, the nonprofit landscape is facing a lot of sort of unique challenges, and this is really where we are located. And I just wanted to also acknowledge at the start two important considerations within the current landscape. One being that we've increasingly been seeing that different stakeholders are coming together for change. So there is, of course, the Samaj, Bazaar, and the Sarkar framing. And we do know how different stakeholders are sort of working at these challenges in different ways. And I think also very important when we're talking about justice and rights, that we talk about moving beyond strategic philanthropy, which is basically looking at very quick, very measurable, very tangible outcomes. And we are really looking at, social justice and what do we need to address what's going on through long-term shifts where we need to really interrogate the power relationships. And just a quick background on the research. This is actually via an ISDM fellowship. And this research was led through a multiple case study with 21 respondents, and really looking at what are the key enablers and the demotivators for Indian philanthropy supporting justice and rights work by nonprofits, and also speaking to nonprofits to understand how are they navigating this journey. So again, just a very quick overview of the respondents who I spoke to for the research. So, organizations that work across different areas of justice and rights, on climate issues, the environment, on people's empowerment, and nonprofits. Some of them do have a very long history of working on this, given that a lot of funding for this also was led by foreign philanthropy in some of the earlier years. And of course, increasingly the role of private foundations and funds in India, and also philanthropy support organizations, also known as intermediaries, who've had a very growing influence. So to really speak to these three groups to sort of try and understand what's going on. And when we look at what the research helped uncover, really these are some of the key enablers and demotivators that came up in terms of funding, which relate to four core dimensions. One being the identity and the approach of the philanthropy, then also looking at the external environment within it operates, looking at the grant-making process, and also the project praxis. And I'll get into each of these facets in a little more detail in the next few minutes. Also, of course, the green arrows here are the enablers, the red ones are the demotivators. So if we look at how identity and approach influences funding, what came out very strongly is that for foundations that are diversely constituted, and this is across levels from the board to the leadership team, the staff, they are really able to unravel the layers better. They are able to enable more intentional funding. And also as private foundations engaged on this journey are going forward, and if they're able to share their learnings with one another, which sometimes does tend to prove challenging, but that also does really motivate funding. And linking up to the third point, that when there's more experience of funding and learning around that and implementing those learnings in future projects, that does sort of really motivate funding. And of course, for those who are looking at funding this sort of work, it is going beyond projects to really building up a more enabling ecosystem. And just the second quote on the slide, as you can see, it's from one of the foundation surveyed, who shared how a very intentional hiring practice, which is looking at really including people from historically marginalized communities, how does that really translate across the project in terms of all the conversations and the decisions. And then if we were to look at how does the external environment influence funding, given that this work is really demanding accountability, there is a high perception of risk. We are also operating within a landscape of frequently changing regulations. So as we can see in one of the quotes, the third one, a foundation is telling us how they are wanting to support a lot of unregistered groups, which they feel do really good work, but they are not able to do that within certain conditions for grant making. And also above that quote, a nonprofit, which is talking about how they would really be interested to leverage PILs. And they know that is a legitimate Indian instrument, but they're just not able to do it. So these are just two of the examples that I just wanted to share. And looking at how the grant making process may also be influencing funding. When we look at the way the grant is structured in terms of its duration, flexibility, how community focused it is, all of this does enable funding. And increasingly, we do see that a lot of private foundations are also making a lot of improvements to their existing grant making structures. And that does enable what's going on. But at the same time, I think we're looking at a space of justice, rights, where the way it's positioned, the way language is used, it is often alienating different stakeholders from each other. And so this is really proving to be a key demotivator. And when we come into how the project praxis, how does that unfold, there is this concern that sometimes crops up between what is the intent, what is the implementation, are there gaps, concerns to do in terms of attribution, because we are talking about complex changes, as we can see in the first quote, and it's difficult to attribute it to any one actor. When we are looking at impact within very narrow terms of is it very certain, very measurable, short term, then that tends to be a demotivator. But if we are really looking at systemic shifts, that is where philanthropy that's able to work with this in mind is really able to enable funding. And also increasingly foundations are doing a lot through the grant making process in terms of networking, building capacity, sometimes introducing their partners to other potential funders. And really these are some of the very enabling practices that are shaping up. And when nonprofits were surveyed for the study and how are they navigating this landscape, I think a bunch of very interesting things came up. Also, of course, this was more prominent among nonprofits who are already stable to some extent and are able to invest in some of these additional areas. So very interesting to see that many of them are diversifying their funding sources. They're seeking to part fund certain things. They're seeking cross funding. Interest in retail fundraising has really grown. Some organizations have really been able to explore that very creatively. And often they are looking at building support for issues rather than specific projects. And we have a lot of different examples from that in the paper. There's also how are they strategically framing the work, a lot of interest around building narratives for support, and also trying to understand what is happening in the international sphere. So how is foreign funding flowing? How is that influencing domestic funding? And really trying to understand and navigate all these trends and patterns. And of course, it's very important to be very compliant to the changing regulations. So these were some of the broad areas that did emerge. So really, moving forward, basically what came out very strongly is that we are operating in a very changing, rapidly changing landscape where a lot of nonprofits are also changing their focus areas to more government aligned, government prioritized areas. Funding for justice and rights is facing a lot of resistance. And it is also very true that this is a very small pool of funders who are supporting this work. And sometimes it is also dependent on where their interests lie. And there's a recent ISDM publication that presents this visually quite interestingly to really talk about how funder biases may reinforce their own mental models and limit root cause analysis. And I've also added something from the Bridgespan Pay What It Takes study, which did show a lot in terms of how organizations led by Dalit, Bahujan, Adivasi leaders are much more stressed in terms of their funding. So, moving towards the conclusion, I mean, I think it's quite clear that, we are operating within a space where Indian philanthropy is quite young, and a lot more will evolve as we go ahead. But at the same time, it's important while we go ahead to really look at not only what is done, but how is that being done, and how can organizations work together in a much more aligned way, listening to needs more closely from the grassroots, trying to co-create that journey. And from the research, these were some of the prominent questions that did emerge in terms of further discussion and research. One, really looking at the question of diversity in foundations, really looking at it beyond, say, gender, looking at it much more deeply to see that what could really be a priority for foundations to really institute this. I think we had one of the CSIP fellows from the upcoming cohort talking about how they're working on DEI, and that would be very interesting, really. Also, some of the other questions that emerged was how can foundations work to address root causes, to get to more neglected areas, to make it easier for smaller organizations to approach them. And also, how can we look at the question of accountability more strongly, and not only from the side of the foundations, but from the side of the nonprofits as well, to really see how can we seek stronger governance accountability. And finally, how may foundations reassess their relationship with power, especially when it's to do with the relationships with nonprofits and communities. So I'll stop here, and thank you so much.
Thank you so much for that, Doel. I really, really appreciate the emphasis that you've placed on surfacing the importance of listening and co-creating alongside traditionally marginalized and grassroots groups. That leadership isn't just a voice, but a place at the table. And I think that's something that I really took away from your presentation. And it ties back to the previous conversation on the relational work of philanthropy itself, that the goal is to be with, not for or of alone. I also, think you succinctly articulated one of the biggest challenges that a lot of this work faces, which is the ability to attribute change in complex systems to particular funding or funding streams, or much even more so to individual organizations. Because very often, like you rightly pointed out, the challenges require a collaborative approach, not just on the capital side, but also on the side of civil society organizations. Something that I was wondering whether it came up was, the idea of digital platforms, whether it's media or communication, and the role of those for nonprofits working in these complex spaces, and politically tricky spaces as well, to both push advocacy as well as a more decentralized funding approach. I was wondering whether any of that had come up, and whether funders are investing in such supporting ecosystem that can enable these nonprofits not just to be sustainable, but also to scale their work.
Sure. It's okay for me to respond now or after the other presentation? I'm happy to respond, just checking on time.
I think you can
and
go
other
ahead and
things.
respond if
Okay.
you want to. Go
Okay.
ahead.
Okay, sure, great. Okay, so yes, Gautam, I think that's a very interesting question you raised in terms of, the work on media and communications and how our organizations working in this domain feeling. We did have respondents who are working in this area. And I think it came through very strongly that actually support for media rights and freedoms, and especially from domestic funders, has been very challenging. And we also have the example of the IPSMF, which has done some incredible work, supported a lot of independent media entities, as we know, but has been facing a lot of pressure. And some of the respondents also attributed that maybe these are the pressures that other funders have seen, and that has sort of restricted more funding in this domain, which I think brings us again back to what we were saying, that when funders who are able to support very sort of more sensitive, contentious areas, when they're able to share that learning and they're able to really peer motivate and influence others, that can be a very strong enabler, but it sort of remains a bit of a double-edged sword.
Got it. And the question on digital platforms and for communication and fundraising.
Sorry, could you just repeat that aspect?
I was saying, the possibility of using newer digital media platforms for both comms and distributed fundraising.
Right. So, I mean, among the nonprofits that we spoke to who've been able to invest in these areas, they are exploring new ideas, and there is a lot of interest and appetite there. But at the same time, there is a large segment of nonprofits who are really struggling to get here, where they've not been able to invest. So really scaling up that side, that has really been quite challenging.
Thank you so much. I believe we can move into the next presentation and then take questions for both together. Ketiki and Kathy, over to you.
Yes, thank you, Gautam. Just give us 1 minute to get started. Are you all able to see our screens?
Yes, Katie, we can.
Great. All right. So thank you so much to the CSIP team and to you, Gautam, for being here today. We're excited to share the key insights from the study that we've been doing at CAPI over the last few months on mental health philanthropy in India. So I'm Ketki Purohit. I'm the center head at CAPI, and I have with me Kathy, who is a research associate here. So I think the first question to ask really is why philanthropy in mental health, right? And to link this back, philanthropy in mental health, to the theme of today's conversation, which is philanthropy in uncertain times. So the answer to that is that, mental health has not really been a priority for donors. It's not been very high on the agenda. And this makes sense given that, India is a low-income country and there are a lot of pressing needs: access to basic nutrition, hunger, education, health, housing, and so on. And so that's one of the reasons that mental health really hasn't climbed to the top of the priority ladder so far. But I think that, as we move ahead in a very uncertain world, and COVID also showed us that, the world can change in the blink of an eye, and we all experience the distress of the pandemic together, we're also facing newer challenges that we haven't dealt with before: climate change, conflict, mass migration. And so then mental health really becomes a big priority for all of these things. I think for us as Indians, we're the most populous country in the world, and our biggest asset is really our people. But data shows, and I'm not going to go through all of it, but every 7th Indian has a mental illness. So that essentially means that even today in this group, some of us are really struggling with mental health challenges. And so that's one reason why philanthropy should and must step into mental health, because it is, after all, a collective challenge, and it can't be up to the government alone.
Yeah. Another reason that philanthropy has a role to play is primarily that the sector receives very limited resources. Only 1% of the health budget is actually allocated to mental health care in India. And traditionally and historically, we adopted a lot of colonial laws that mandated custodial care for treatment of mental illnesses. And while all of these have changed, there have been multiple reforms. We have very progressive laws and policies in country right now. However, the budget is extremely skewed towards mental health institutions, which receive almost 85% of the funding in the country, which is exactly opposite to what World Health Organization is saying. The World Health Organization is calling for countries to actually focus their resources at the base of the pyramid, right here, to proportionally really address mental health care needs of the population. The institutional care is for severe mental illnesses, and that's high right now, getting a lot of attention from government, while philanthropy has and needs to pay a little more attention to the base of the pyramid to ensure that the services are proportionally distributed.
our insights are actually coming in from 36 in-depth interviews with variety of stakeholders that we've interviewed from March to October. And this is just a list of those stakeholders.
So what we found are two key things, right? First is that, of course, mental health philanthropy is new in India. It's only really in the last 10, 12 years that philanthropy in mental health has kind of picked up. And even now, I think there are only a couple or two or three that have an expressly dedicated mental health portfolio. Some others kind of subsume mental health under disability or the larger kind of health portfolio. But even amongst these early donors, we've noticed that there are two key approaches that exist in terms of how they fund mental health. These approaches are by no means mutually exclusive. We've also seen overlaps between the two. And one is not better than the other. They're needed, both are needed, just given the immense needs in the country. But we'll get into what these approaches are just now. So the first one is, funding or supporting an existing institution. Now, if you're doing that as a donor, then what you're doing is that you're focusing on treatment more than prevention or rehabilitation. Not that these aspects aren't there, but it's really more the treatment and care under the umbrella of an existing institution. This institution can be a clinic, it can be a specialist hospital like NIMHANS or some other psychiatric hospital. It can be a long stay home like for palliative care that the CIPLA Foundation has funded in Pune. It can be, funding a helpline, which a lot of donors have done, like the Empower Foundation, which is funded by the Aditya Birla Trust and many others. So here really what happens is that the patient is going to the treatment facility for care, and care is largely delivered for the most part through specialists like psychiatrists or doctors or clinical psychological nurses and so on. The other one is community models of care, which are slowly gaining traction in India. Now, this is different than the institutional approach in that here care is taken to the community. So you're, instead of the patient having to come into a facility, you're actually delivering the care at the level of the community where the needs are. The other big difference is that this approach doesn't really rely that much on specialists, which are in severe short supply in the country, but instead believes in training other individuals. So it could be volunteers from the community, it could be ASHA workers, it could be teachers that are delivering the program at a school, it could be prison authorities, it could be a number of others that are kind of delivering certain basic services. Institutional care is appropriate for the more severe forms of mental illness, whereas the community models of care is especially helpful for common mental disorders like anxiety or depression. There's also focus in the community models on the prevention and rehabilitation aspects, because a lot of programs talk about self-care, awareness, as well as are integrated with rehabilitation or improving the quality of life. So one thing that we've also noticed is that there could be multiple goals within the community model. It doesn't have to be focused just on mental health. So, for example, the Mental Health Action Trust in Kerala works with the Department of Fisheries and targets communities of fisherwomen in various districts of Kerala and helps them with sustainable fishing practices, entrepreneurship, as well as providing mental health support. Another example could be the Raintree Foundation, which works on 3 pillars: climate change, alleviating distress from rural migration, and things like substance abuse, counseling, and so on in rural Maharashtra. So in a lot of these types of programs, there are a number of socio-economic goals that are kind of integrated into the program. The third aspect really is research, funding grants for research, as you have done at RNPF Gotham. And these can kind of span across the two approaches, and insights from research, medical, scientific, and so on can help inform and guide both of these approaches in the future. So, of course, what we're also noticing is that COVID has been really a catalyst in terms of government interest. A lot of our interviewees, donors, as well as nonprofits, told us that local governments, state governments, central government had approached them during COVID and asked for assistance with setting up helplines and setting up, training centers. So for example, the Empower Foundation set up a helpline for CSIF personnel at the Bombay airport. So this was initially started in Bombay, but is now post-COVID in play at all 68 airports across the country. The other interesting thing vis-a-vis government is that mental health is not just of interest only to the health departments, but we're seeing a lot of cross-sectoral government officers and bureaucrats also approach nonprofits and donors to work with them. So for instance, the Law Foundation, which is a nonprofit in Bihar, works with prison authorities there to provide, listening circles, peer-to-peer counseling and rehabilitation for those that are incarcerated in Bihar prisons. And this is very much a partnership with the government. The MHAT example previously with the Department of Fisheries in Kerala is another one. And we've seen a lot of these other pop-ups or partnerships from departments that are not just in health. Now coming to impact, of course, what we've observed is that, first of all, it's extremely challenging to capture impact in the field of mental health for various reasons. It's intangible, it's qualitative, it's deeply personal. What we've noticed is that donors are trying to capture impact, but they use, a wide range of methods. So for some donors, impact is very important. For some, it's not so much the impact, but really just to see whether the nonprofits that they fund and support have been enabled to do their work best. There are some qualitative tools that are at play in mental health that, for example, through storytelling, narratives, focus groups, listening circles. Quantitative tools include, both randomized controlled trials as well as clinical assessments like the patient health questionnaire, which are self-reporting or can be done, by a volunteer. And so there's a combination of both depending upon the specificities of the intervention and what they're really trying to achieve. But however, in terms of, the international community, the discourse really is moving towards capturing functional outcomes. So things like, is this person able to participate? Does this person attend more functions? Is this person able to have a job? Is this child able to go to school? For a newborn mother, is she able to help her newborn achieve some development milestones? So these are basically the ways some ways in which you're able to assess the actual impact on a person's life and the quality of life and their capabilities, rather than just, quantitative things like a slight increase in anxiety or a decrease in depression.
Yeah. Some of the significant challenges that the sector still faces with respect to getting a lot more funding is, one, first and foremost, that the mental health is extremely stigmatized. So very few funders who are funding mental health primarily do it because of personal connection to the issue and a personal understanding of mental health. Others actually stray away from funding mental health because they do not want to be associated with mental illnesses. So it's not as attractive to, fund for bipolar or schizophrenia because of the association that's associated with mental health. Another aspect that's challenging is that there's no clear path in terms of what works, what doesn't work. There's lack of information, lack of case studies, proof of concepts, or evidence that's not easily accessible for donors to understand the space. So a lot of them have had to pioneer their pathways and identify their strategies and create and navigate the space on their own. A third challenge that we've observed is that a general challenge with identifying the right kind of partners for implementation. There's a limited pool of nonprofits who are focusing on mental health care delivery. And so to get the right kind of partners are able to deliver donor-focused aspects is a bit of a challenge. Another challenge that the sector already, which exists in the sector, is the massive human resource crunch for qualified professionals. And to implement mental health intervention, there has to be a lot of resources that have to be dedicated towards building capacities of not just the qualified professionals to be able to deliver interventions in local context, but also of community workers to be able to deliver specific mental health interventions. Lastly, the impact piece that KK has already touched upon, its impact is largely invisible, and it's not as easy, or so it's easier to fund 20 cataract operations and to move the needle from blindness, partial blindness, to really visually giving eyesight to someone, but that's not the case with mental health.
So despite these challenges, we don't think that, they are insurmountable, and there are still areas that philanthropy has an opportunity to move the needle on. So we think that philanthropy can really come in three ways, right? One is to fund things that are underfunded, to be a champion, and of course, to play the role of risk and patient capital to kind of help in innovation. So in terms of the first one, which is underfunded areas, it's of course the remote regions of India where, community health models can really go in and play the role so that the patient doesn't have to lose a day's wage to travel, and in integration with things like the district mental health program or primary health care. But it's also in terms of issues, right? So like we showed you before, a lot of the money right now is going to institutions, whereas the prevention and rehabilitation stages that the WHO also champions are missing enough and adequate attention and resources. The second thing really is to reframe the mental health challenge not just as one that's a health challenge, but understand and reframe it as a development one, because then that shifts the burden of responsibility as a collective one rather than just on the government or just on the social sector. And there are also, of course, economic returns from framing it this way and getting the private sector to kind of step up as well. But also for donors to kind of talk more about their own experiences funding mental health, what they struggled with, and why they chose to do so anyway. And then another thing that donors could do, and we heard this from a lot of people, is that knowledge around mental health is concentrated in pockets. So it's with an expert, or it's with somebody who actually studies the issue. But what's really needed is a common platform to kind of bring all of this knowledge together. So finding spaces where this kind of collective consciousness can be created around mental health and learnings can be synthesized would be really, really helpful. And finally, of course, funding technology to kind of just really disrupt the sector, and funding new financial products to bring in more private capital from, venture capitalists and others into the sector would also be really, really helpful. So these are some thoughts on philanthropy and mental health in India, and we're happy to take questions.
Thanks so much, Kathy, for that. I think there's a broad similarity in some of the meta framing of the questions around both mental health and social justice. They span a variety of areas. Mental health, like you indicated, warrants an integrated intervention across a variety of spaces, whether it's healthcare, access to socio-economic resources, and stigma reduction. You touched upon it at the end with the idea of technology is something that's been popular, but it remains to be seen how much of the scale that it brings is meaningful at some amount of depth and change for the individual. Given the nature of the systemic gaps that will continue to remain, given all of the limitations that you talked about, I'm curious about what you heard or what you might suggest around the challenge of limited proof of concepts. Monitoring is difficult. So what are the kind of indicators that might be locally relevant, at least, that could have helped or could help capture outcomes beyond clinical assessments?
Yeah, so I think the question actually has two parts. One is that, yes, there is limited knowledge, but I think I think that that body of knowledge is growing. So increasingly, nonprofits that are implementing, say, community health, mental health models are investing in monitoring and evaluation. So they are, actually spending on RCTs. They are spending on hiring consultants to kind of create that evidence base. What has been missing, particularly for community mental health models, is that this knowledge has stayed in those pockets. It hasn't been amplified. So the message really kind of needs to get out there, because nonprofits are not able to do to deliver the program and capture the results and tell their story and kind of amplify that messaging. So there is a growing body of evidence around what works. And then in terms of locally relevant indicators, I think a combination of, I think it's really important to include the qualitative aspects as well that get missed out in the quantitative ones. So things like, narrative tools like storytelling or focus groups, or some of the proxies that can point towards an enhancement in capability, like, the ability to go to work, the ability to actually seek out healthcare for a physical problem, the ability to actually attend a family function in a village. So these are some examples of functional outcomes that can point towards an improvement in mental health, as well as, other socioeconomic indicators. But having said all of this, we also believe that mental health is a long-term issue. It's not something that you can solve quickly, because it's a two-way street with all of these other development issues, right? So donors do need to take a long-term approach to the issue and not emphasize too much on monitoring and evaluation or impact assessment. It is, in a sense, still, at least in India, very much at the stage of a risk capital or ameliorative funding, where you're just doing it to relieve some suffering and provide some amount of care.
No, thank you. I think, there's one thing that both the presentations highlight is the need to support issues in communities beyond this siloed, time-bound projects. That change is complex, multidimensional, requires time, and that progress hinges on mindsets embracing complexity, flexibility, and shared accountability, in particular, the capital. So Doyle, if I might, I'm curious about, how funders can structurally enhance accountability to the beneficiaries, but really the target, the communities they seek, in whose name they seek to deploy capital. So what are some of the ideas that emerge around accountability? You're on mute.
Right. Yeah. So I think around accountability, what through the research I heard quite strongly was, one, also I'd like to share that, some nonprofits shared how first they are also trying to institute deeper accountability mechanisms in terms of, how are they sharing stories of impact, trying to get beyond stereotypical ways. And I think the other aspect was that how can funders also be a part of these sort of co-created structures in terms of, being accountable to the outcomes with the partners, with the people on ground. So how can we look at more co-created structures, and how can we also look at frameworks that are much more adaptable? Because when we are talking about community-led change, often there's a lot that's also changing as you go ahead, because you're talking about communities that are very vulnerable and marginalized, and when you're also looking at cycles of funding, say that are 3 years or 5 years, within that process also there's a lot of change that's constantly ongoing. So how do we look at sort of co-created frameworks where all stakeholders can be much more accountable for each other, and how do we also look at adapting that as we go ahead?
I know we have a few minutes left. I just wanted to check if there were any questions from the audience as well.
Actually, I have a question for Doyle. Is that okay? So earlier you talked about diversity in terms of the funders. I just wanted to understand what you meant by diversity.
Right. So by diversity, I meant in terms of how are the teams constituted, and diversity in terms of what are the backgrounds of members, right from the boards to the leadership to the staff, whereas in terms of is there representation from historically marginalized communities, because often a very starting point to diversity becomes gender. And I think, that has definitely been playing itself out. But is there representation from marginalized castes, from people, say, who are disabled, with varying levels of ability? So that's really what I was referring to when I referred to diversity. And then it did turn out that there's a lot more that can definitely happen, especially when we're talking about private foundations, which do emerge from family interests. So in the earlier years, specifically of foundations, they do tend to be much more heavy on representation from immediate family members. And this tends to be much more concentrated at the level of the board. And over time, there are some foundations that are able to diversify, that are able to have representation from marginalized communities. And this also does play out to some extent across the leadership and the staff, but it's still an area where, a lot remains very heavily held by the family. So then you risk being limited to what the family's interest or approach is, as opposed to being able to serve a wider ambit or to sort of surface deeper questions, because you do have that representation across levels.
Thank you. I was just wondering if there might be any other questions. We're at time, but we might have time for one last question if there's anything from the audience.
Yeah, we can take some time.
Well, if there's nothing, maybe I can just conclude. Thank you to all three of our presenters. Thank you, Doel. Thank you, Ketiki. Thank you, Kathy, for your presentations, the engaged discussion. And for me, my real takeaway was that Indian philanthropy has the opportunity now to step into a brand new field, and can carry the spirit of collaboration, empathy, and most importantly, persistence to progress towards an equitable India for all people and for all communities. Thank you for giving me the opportunity to be here.
Thank you, Gautam.
Thank you.
Thank you, Katie.
Thank you so
Kathy,
much.
Joel. And thank you, Katie, for asking questions, because sometimes you often forget that we can ask each other questions as well when you're on the panel. So thank you for that. We shall take an 8-minute break. We have the panel discussion coming up, but I believe we've been going on for a while for those of you who have been around. So we'll just take a quick 5 to 8-minute break, and we'll be back for the panel discussion. So hope to see you soon. Welcome back, everyone. I hope the break helped. For those of us who've been around right from the start, we have been witness to some great discussions under some insightful themes over the past few hours. For our next session, we are glad to be joined by 4 experts who, I have no doubt, will further enrich our understanding of philanthropy from a wider lens to their discussion today. Bekinkosi Moyo is the director of the Center on African Philanthropy and Social Investment and an adjunct professor at the University of Witwatersrand's Wits Business School. He's a leading writer on issues of African philanthropy with a keen interest in questions of African resources, democracy, and governance. Dr. Pamela Weeking is the Stead Family Chair in International Philanthropy at the Lilly Family School of Philanthropy and Professor of Societal Significance of Charity Lotteries at the Center for Philanthropic Studies at Vrije Universiteit Amsterdam. She studies cross-national and interdisciplinary explanations of philanthropy. Dr. Susan Appy is Associate Professor of Public Administration and Policy at Rockefeller College of Public Affairs and Policy at the University at Albany, SUNY. Her research is on government nonprofit relations and the dimensions and evolution of the nonprofit or NGO sector, focusing on the shifting political, regulatory, and funding environments for civil society. This discussion was to be moderated by Ingrid Srinath. Unfortunately, Ingrid had a really late emergency, so she had to drop out. But we are blessed to have Dr. Abhishek Bhatti, who graciously agreed to step in, and someone who's extremely well placed to be the moderator for this panel discussion. Dr. Abhishek Bhatti is the director of the Asian Studies program and an associate professor in political science at Bowling Green State University. His research and teaching focus on nonprofit and civil society, international development, and global politics. Over to you, Abhishek.
Thank you, Jofin, for a very generous introduction. Great to see you, Pamela, Susan, and Bekinkosi. I think we are spread across different continents, so we got everything covered here. I'm very humbled to replace Ingrid here. She had a family emergency, but I do want to acknowledge that some of the questions which I'll be asking came from Ingrid, but I kind of tweaked a few things around. But I was hoping for a more candid discussion, little bit more jargon-free discussion, so that we can include everyone into our conversations. I'll start with some questions, and then we can have some Q&As from the audience. So we'll keep it candid. We'll keep it easing. It's Friday night here in India. It's Friday morning for you guys. I'm sure you're loaded with coffee. I had too many teas today, so I think we will have fun for an hour. So I'll just quickly start with my first question. So I just thought, just to, kind of put yourself in this situation, like where everybody gets to see you, what's something which you're working on currently? It could be a research, or it could just be a project, what you're working on, so just start with that. And I have some questions. We'll keep the conversation going. So I'll start with you, Pamela, Susan, and then Bekinkosi. That's how you are placed in my screen. So if that's okay, and then we can switch a few things around here and there.
Thanks so much, Abhishek. And having fun for an hour sounds like a great idea. It is Friday afternoon. I'm in Europe. I'm in the Netherlands. And it's such a pleasure to be you. Thank you, Jopen and Swati, for inviting me and for this panel. So talking about research that I've been working on recently and that I see as really important and emerging in Western Europe and Northern America, where I am working, is unrestricted funding. I think there have been a lot of developments where foundations and big funders, like for example Mackenzie Scott in the US, give more trust-based, unrestricted funding. And I think this is a really important development. We saw during COVID the need for more flexible funding for organizations, because if you don't have any flexible funding, if all your money is stuck in projects, you cannot address those emerging needs that happen when a disaster like COVID, but also a natural disaster happens, or when things changes in the environment where you're working as an organization. And together with Arjen de Wit, we have just published an article on the effects of unrestricted funding on nonprofit capacities. Because what we argue is when organizations receive more different types of unrestricted funding, they can actually build their nonprofit capacities. And those capacities are, for example, their financial management. To some extent, they can build reserves with that flexible funding, although the funding organizations don't really like it if you use that flexible funding for reserves. But they can also better work on their mission orientation. So working really on the things that they think are mattered, and they're not donor driven, just focusing on the things that people will fund. And of course, the adaptive capacity, which I already just discussed. But with flexible funding, organizations can address the needs that arise when they arise. So that's just a summary of one of the things I've been thinking about and working on.
Thank you, Pamela. Susan, to you.
Great. Hi, everyone. It is a true pleasure to be here. There are a lot of familiar faces and good friends and colleagues. So I'm happy to be here. I'm happy to share some of my work right now. I am starting a comparative, or in the midst of a comparative study, which is something I care about in terms of thinking about comparative study in philanthropy and civil society studies. And so I'm looking at, we have heard of remittances, which has gotten a lot of attention globally. It's a huge mechanism to redistribute funds, often from the so-called global north to the so-called global south. And these remittances are generally direct to family and friends, right? I'm taking a look at collective remittances that are happening and being channeled through nonprofit organizations. So I'm interested in this, cross-border philanthropy that's happening from, in the case of my study, the US, diaspora groups, migrants, immigrants who are living in the US, pooling their money together and using nonprofits, which 501c3s in the US legal context, to then send money back to the homeland, not to just family and friends, but for development and social projects, right? So building plazas, building schools, funding scholarships, doing public works, such as bringing electricity to spaces. And so I'm taking a look at how different groups are going about this. So far I've done fieldwork both in the US side and on the ground with the projects in Mexico, India, and Colombia. And I'm hoping to expand to some other countries like Egypt, the Philippines, and Nigeria. And all of these countries have a lot of cross-border transferring of resources. And, just to kind of piggyback off of something that Pamela said, one of the benefits to some degree, while it's at a much smaller scale than Mackenzie Scott, but some of this funding that's being brought back to the homeland does have this strength of being somewhat flexible, right? And I think that just to speak to the importance of unrestricted funding and that flexibility that some of these types of arrangements can have, I think is really important. I think I'll just stop there. Thank you.
Thank you, Susan. Beck Kosi, to you.
Thank you very much. And likewise, it's a huge honor and pleasure for me to be on this panel, but also to be sharing the panel with my friends, Pamela, Susan. Nice seeing you again. So there are two levels at which I might want to just share what I'm involved in. One is, as you know, I established CAPSI, the Center on African Philanthropy and Social Investment, purely to, scope and begin to interpret the philanthropic landscape in Africa. So in that regard, the center is involved in a number of projects. Just to name a few, one is, a MasterCard Foundation funded project over 5 years, focusing on 17 countries across Africa. The interest is to establish the extent to which the nonprofit sector is contributing to decent and dignified jobs and opportunities for young people. And so that has seen us collaborate with about 17 partners across 17 countries, most of them university-based centers. I think the second project that I want to highlight at the center level is one of, just trying to understand how philanthropic expressions manifest themselves in different parts of the continent. So we're tracking high net worth individuals, we're tracking foundations, we're tracking individual giving, we're tracking corporate social responsibility and investments, among others. And just recently, we published a book on COVID-19 and its impact on different sectors. We looked at the business sector, foundations, and civil society. At a personal level, I've always been, intrigued by the history of philanthropic foundations in Africa. And so I've been studying the history of philanthropic foundations, especially from an international perspective. And recently, we presented a paper that we're working on at the Lilly School of Philanthropy, focusing on the 30 years of the Ford Foundation's interventions in Southern Africa. But that then led us to also look at others like the Open Society, which has been in Southern Africa also for 30 years, the Bill and Melinda Gates for about 25 years, and then comparing that with African institutions like the Africa Women's Development Fund, Trust Africa, as well as your high net worth individuals based foundations like the Danjuma Foundation. So I think those are some of the things that we're interested in. There's another one which is really fascinating for us, which is looking at the barriers for civil society to scale up their interventions in the continent. And that again is work that we've been doing with a number of partners from across the continent. I think the first version looked at 5 countries. We have extended that to another 15 countries. Hopefully, in 5 to 10 years' time, we would have studied all the 54 countries in the continent. So thank you.
Thank you. Pamela, I think you just touched upon this issue of unrestricted funding and on capacity building. But my next question is kind of tailored towards this, but kind of continuing the conversation. So what are some of the trends you're seeing in your, and you are so global, right? Like you study Europe, you study US. What are some of the trends you are seeing both in Europe and in the US, but also globally in philanthropic research?
Yeah, so one of the trends indeed is this unrestricted funding that I think deserves all the attention it's getting and maybe even more, because it can be a solution for a lot of organizations that are trying to survive in a very complex world at the moment. And one of the things I often talk about with funders is, have you considered how your funding strategy aligns with your mission of change? And oftentimes they have thought about it. But when you look more in depth, you see that they have this huge change and this huge mission. They want to change the world, system change, make sure there's no more poverty in the world. And then they use this short-term project funding when they fund organizations. And of course, those short-term restricted projects will not help to get to these really big changes. So I think that's a really important thing to consider when you're a funder, but also when you're a grantee. Oftentimes grantees solicit funding for specific projects, but it's also worthwhile to think about having conversations with your funders about the need for your organization to have core funding for your organization. And I think this discussion needs to go both ways. You have to talk with each other about what are the needs of the organizations and how can both organizations, the funder and the grantee, jointly advance both their missions.
Thank you. Susan, same question to you. What are some of the trends you are seeing in your area of research in philanthropic, both globally and also geographically?
Yeah, so I have been working kind of more comparatively and branching out, but I did, and I continue to do a lot of research in Latin America. And so I'd like to speak on that. And I happen to be a co-editor of Voluntas, and we just put out a special issue, so I'll give that a plug, on Latin America, where we're touching on lots of issues, not just around philanthropy, but volunteering, other civil society issues across there's 5 articles, an intro and an editorial by myself. And so that's a good picture of kind of where some of the research is in the field in Latin America, I think. So please do take a look at that if you're interested. some of the topics that I think matter related to philanthropy in Latin America and elsewhere, but I'll speak on Latin America, is the intersection of philanthropy with democracy and thinking about what that looks like, how philanthropy fits in to supporting democracy and not supporting democracy. And that I think also relates to questions that we're seeing around equity issues in philanthropy and really exploring why we have philanthropy in the first place, which gets at some of these equity issues. And then, of course, in Latin America, and this holds true, you know, philanthropy is very much rooted and still today in the Catholic Church and the influence of the Catholic Church. And so I feel like we can't discuss even more modern trends of philanthropy related to democracy without acknowledging the church and its influence in how we understand philanthropy, or maybe better said, charity. And I'll mention one thing, and this also speaks to some of Pamela's previous research on global philanthropy, is thinking about, you know, the usage of even that term. In Spanish, you won't hear philanthropy being used so much in some contexts, but I'm thinking in the context of Brazil, for example, they're managing the term, you know, social investment. And so I think thinking about some of the terms in our own research and what it's describing, I think is really important. And so I hope we talk a little bit about that too. I'll leave it at that.
Becky, I think maybe we lost Abhishek for a moment. So can you continue?
Yeah, great. I think we lost him. Yeah. So in our case in Africa, there are a number of trends, but I'll just pick on a few. So the first is that previously we did not really have much data and information on the different forms of philanthropy, whether it's in institutional format or indigenous format. So over time, we have seen you know, more growth in the number of institutions, whether it's foundations, trusts, ecosystems, infrastructure organizations, but also more data that has been collected over time. And so now there's a bit of some understanding of what philanthropy looks like and how it ought to manifest its interventions. So you pick up any major publication today in the continent, you actually come across an article on philanthropy or an article on anything that's related to the role of philanthropy in development, among others. But this wasn't the case, I would say 15, 20 years ago. The second is that there's also a heightened interest in the role that philanthropy plays in policy development, in particular public policy. And we see this especially on the debates around the Sustainable Development Goals and how philanthropy was involved, you know, starting with the many consultations that led to the adoption of the SDGs, but also philanthropy is taking a keen interest on how they've always, you know, worked in any of these 17 goals, but without necessarily having called it SDGs. And now they are framing it directly to link with the SDGs. So there's a big understanding that philanthropy plays a huge role in public policy, but also in shaping, you know, how the development in any country could take up. But there's also, you know, I think an appreciation that philanthropy is catalytic, and therefore governments and the private sector need to form that triangle of success in a way. But there's also, I think, you know, the growth of high net worth individuals is something that is very much noticeable in the continent, and there are huge expectations on high net worth individuals, and they haven't really, I think, played that role in the past, and now they are called upon to step up, and we are beginning to see the trends and to understand what their habits are and what they are interested in supporting. So, for example, during the COVID period, for the first time, high net worth individuals in the continent gave 7 times more than they'd ever done in a decade. And that's fascinating because it tells us that there are probably specific traits that we need to look at in order to unlock the potential of high net worth individuals. I think the other is, I think for me, it's also to look at, the debate on issues of decoloniality, the debate on shifting the power, the debate on issues of localization. I think it's more pronounced here in the continent than maybe in other parts, simply because Africa is a former colony of different jurisdictions, and philanthropy tends to also follow those patterns. It's easier for Anglophone philanthropy to end up in Anglophone African countries, and for the French philanthropy to be in Francophone countries. And so the debate around, how do you decolonize philanthropy? How do you make it relevant? Is actually very much higher now in Africa than maybe anywhere else. And then finally, I think I also see, because I'm here, I probably was one of the very first few people to study philanthropy and write on it formally. I see now a huge interest in people wanting to study philanthropy. And as a center, we have actually, developed a number of programs from short courses all the way to PhDs. I just graduated 3 PhDs this past week on philanthropy. So again, for us, that's something that is really exciting at this point in time. Thank you.
Sorry, I hope I'm audible here. Probably you can't see me. It just there's some technical issues with the electricity. But just to continue our discussion, like we were talking about the trends in philanthropy and within the geography, but also some of the things. Am I still connected here? Okay. Some of the what do you wish the funders of the civil society knew better, understood about the philanthropic research? And then I'll jump in with some other questions here.
Can we just continue in the order we've been using, or do you want to shift?
Yeah, sure. Let's go. Okay. Sure. How about we just reverse the order? Begin, because if you want to start first, and then we'll go the other way around.
Sorry, can you repeat the question? I kind of lost the first part.
Yeah. So what I was curious to ask is what kind of what do you wish the funders and other leaders understood about philanthropic research based on your area of expertise, both geographically, also what you study?
Okay, great. So one of the trends that I wanted to mention, and it's linked to your question, is that in the region now, we're seeing a scaling back by big foundations. They're changing their strategies. They're focusing on other regions. And as a result, this has affected a number of non-profit organizations that used to be funded by these organizations, especially those that focus on social justice, philanthropy, or social justice issues. So you can imagine, after 30 years of the Open Society Foundation supporting all sorts of organizations here in the region, and then all of a sudden, they decide that they are changing, they're closing offices. So by the end of this month, the 31st of December, all regional offices that the Open Society used to operate from will be closed. And that has a huge effect, not just on our attempts to study philanthropy and this impact, but it also has a huge impact on the groups themselves. For us, obviously, as a research institution, this is a good opportunity to actually study these trends, especially where big foundations have been part of creating dependency. They've been part of the ecosystem. And then they say we are closing down or scaling back as if they are solving the problem. But in fact, they've been part of that problem. They've created it. And then now they are just packing their bags and leaving. So from a research perspective, what are the implications of that, and how big is that in terms of scale, but also in terms of impact? So that's a research area that we'll be fascinated in. But I think the second is that is in terms of the areas that we focus on. So for example, for us to access data on high net worth individuals, it's not something that you can easily just get across or come across. Most of the high net worth individuals have their data managed by international banks. And those that are managed locally, it's almost impossible to actually get their data. So we have to invest a lot of time in terms of just, getting the politics right, but also managing our relations with their foundations, with the high net worth individuals themselves. So that at the end of the day, what we put out as information is actually verified by them. So it therefore means that our research is not going to be short-term. It's research that is going to be long-term. It's research that will need to be updated now and then. And that requires maybe even more investments, which some donors are not prepared to, to stay on, because they just want quick meal and quick results. And I think the final one is that, especially for us here, philanthropy in Africa presents itself in different dynamics and different ways, which might be totally different from what the donors are actually used to. And having to present that narrative to traditional donors at times challenges their own notions and their own understanding of philanthropy. And it really takes progressive foundations and donors to actually allow themselves to see that African philanthropy is as good and as equal as other forms of philanthropy from elsewhere. And that takes, a good chunk of donors understanding the need to decolonize themselves and to decolonize the academia. Thanks.
Thank you, Becky. I would say that some of what Becky spoke about in Africa has happened or is happening in Latin America too, in terms of shifting aid and shifting donor priorities and the implications on civil society. And I think there's a lot of really good research questions that can come out of that situation. And I would want funders to recognize that and support that. When I was thinking about this question before, as researchers who are constantly looking for money for their research, I could probably make a list of 100 things that I want funders to know, right? But I'm going to highlight 4. One being, and this gets at some of what Becky had just mentioned, just some of the inequities globally on research and related to language, the field's interdisciplinaryness, which I think funders need to recognize. I'll talk more about that. The importance of comparative work, and then the importance of research on pedagogy, how we're teaching philanthropy. I think that's important. So in terms of, and I've spoken about this in many different contexts, so for some folks this might be a repeat, but we know the dominant, in terms of research and getting deliverables out for research, whatever those deliverables look like, the dominant language is English and the expectation is English. And I think that puts a lot of our colleagues elsewhere who English might not be their first language at a real disadvantage. And in terms of kind of putting my editor's hat on, we've talked a lot about this at Voluntas and what is the role of the journal itself in tackling this really wicked problem of, English being dominant. And we've really looked to Voluntas as a journal is housed at the International Society of Third Sector Research, which is the professional association whose mission is a bit broader than Voluntas, really, and around creating a community of scholars. And so talking with the association about ways in which we can tackle this issue, and I'm very curious what my colleagues here think, because it's a really messy one. And so, not only do scholars need good training in research, but they might need editorial help, or even being able to present their work internationally in terms of the limitations having funds to do that. And so I think, and then this is represented, we can show this in many ways. I mentioned that we have a special issue in Voluntas on Latin America. Latin America is a region that we don't see a lot of submissions from, and we suspect in part because of the language challenges. And in the last 2 years, we have received 34 articles from Latin America at Voluntas. And 34 of those, that's based on the corresponding author's affiliation. So it's not a perfect measure, but that's the data we have. Of those 34, only 7 were actually published, and 5 of them were in the special issue, which was a process that took a bit more, that actually iStar did offer editorial support, etc. So we're doing things, but we still have a long way to go, I think, about thinking about, what does this mean for the fields and all the great scholarship that is happening in other languages, which we don't necessarily see. So that would be one thing I would want to sit down with funders and talk about. The other is about our field being so interdisciplinary, which I think, of course, is a tremendous strength. I want to work on projects with social psychologists, development experts, historians, policymakers or scholars, which is the field that I feel most at home in. And I think that we need to have research support to support these endeavors. And so that would be something that I'd like to continue to talk about and be more deliberate about embracing. It's a challenge sometimes, for sure, but I think it's really important. And the next two are a little self-serving, I guess, also, but the importance of comparative work, I think, as a field, and we're having these global discussions together, that we can be doing more comparative work and that should be supported, looking at similarities and variants. And I think we have a rich history of that in the field, but we should continue to foster that. And then finally, I'll just mention, we don't talk about it a lot, but a lot of us teach philanthropy. And I would like to see more solid research and more research supported that is looking at the pedagogy of philanthropy. And I'm doing work with a colleague, David Campbell, at Binghamton University. We've looked a lot at experiential philanthropy. That's a model that we use where students have a pool of money and are learning about philanthropy and then give philanthropy or give the funds through a process, etc. And I just think that there's models like this that are being used, not just experiential philanthropy, but other frameworks, other ideas that we can learn from each other and really not only train good professionals working in social change organizations, which I want to do, but also, a lot of my undergraduates aren't necessarily going into public service, but I want them to be generous, good human beings, right? And how can we, attach our teaching of philanthropy to that? And how can it be better supported by research and funders? I'll stop there.
Oh, this is all so interesting, Susan and Becky, and it makes me think back to, I think, 2019 at Arnova, where the three of us, and Abhishek, I don't know, maybe you were there as well, in the room as editors. I'm not an editor, but I was part of the conversation where we were talking about how can we increase the international publications on philanthropy, and with the dominant, I think at the time, 70% of the published articles in our journals came from Western Europe, Northern America, and Australia. And how can we change that? And I think what you're mentioning, Susan, are some great steps that Philanthropy has been taken. And I've seen other journals also taking really important steps to make sure the barriers are lowered for our colleagues across the world who have less access to training, to resources, to support their work. I think that is one of the key things I would like to say to funders. Fund those that are under-resourced, fund those that are working in contexts that don't have the resources that I, working as a white woman in a Western institution, the Lilly Family School of Philanthropy, the only school in the world of philanthropy, that I have a lot of resources, and I'm very thankful for that, but a lot of other people don't have that. And what I try to do personally is to work with a lot of younger scholars across the world, try to help them develop their work, and I learn so much from them also, because I don't know about their context, and through working with them, I better understand how philanthropy works in China, for example. But yeah, and I'm really thankful for that. And that really aligns with the point that I wanted to make, which really builds on other things that Susan was saying in response to the first question about the language we use and the word of philanthropy, and how that is really different across cultures. A lot of people across the world don't use the word philanthropy. And if we all just continue to use that word and focus on that word, we're missing a lot. And I'm especially worried about the measurement of philanthropy across the world. When you use the word philanthropy, you exclude a lot of people that don't see themselves as philanthropists, but behave a way we think philanthropists behave. So they are generous, they are giving, they are sharing, they are caring. But if you use just, for example, the 3 questions in the Gallup World Poll, which is published in the Charities Aid Foundation World Giving Index. Have you given to an organization? Have you volunteered for an organization? Did you help a stranger? And then rank all those countries in terms of the percentage of people that say they do these things. You miss out on a lot of the generosity behaviors from a lot of people across the world. And I think we really should do better. We need to get to a better understanding of what philanthropy means, the language people use around it. And one of the suggestions I've made before is to maybe use the word generosity, as it resonates with more people across the world. But I know Alan Fowler, for example, from South Africa, has termed the word gifting, which seems to work really well in the African continent. So I think we need to jointly do more research, qualitative research, to better understand how, when people see themselves as behaving in the way we think about philanthropically. And with one of my PhD students, or not my PhD student, but a PhD student at the Lilly Family School of Philanthropy, Anastasia Okome, we're doing a study that is like that. Our students at the school have interviewed people across the world and trying to understand what people mean when they talk about charity, philanthropy, and generosity. And the clear thing that came out of those interviews from across the world is a lot of people don't know the word philanthropy. And when they do know it, sometimes they say, wow, that's a big word. It's a big word for charity, which I really love that quote. They talk about institutional giving, and they talk a lot about American wealthy, famous people making large donations. That is what they see as philanthropy. When they talk about charity, it's often about relief or immediate help to those in need, or about religious or regular organizations focusing on the needs, the help to needy. But with generosity, they talk about helping others without expecting something in return, about their willingness to give to others freely and abundantly. And I really like that word, and I hope that can be helpful to us to have a common understanding of when we talk about behavior that benefits other people.
Awesome, thank you. I'm still around. Just we have like about 5 minutes now, and I want to kind of end our discussion on, like, we kind of in a really complicated world, right? The wealth has been shifting, and I think we touch upon several topics about gender-based giving, high net worth individuals giving, also issues related to immigrant and diaspora giving, and also issues related to about global giving to not so popular causes around the world, right? I mean, we covered a lot of topics here. So I wanted to end our discussion first on the question of what really excites you about your work, what keeps you awake at night about what you do, what makes you go every day in the morning with a bunch of coffee. So what really drives you for your work is the number one question I have. And the number two question is that what is some of the thing which keeps you awake at night about the philanthropic research? So 2 questions. I know they're complicated, but you have 5 minutes. I know you guys will do a good job.
Should we really spice it up and I start? Okay. Great. Good question. Always with lots of coffee. Yes. So mine, I mean, I could think a little bit about this, but one of the things that, I've started this research on, diaspora giving, right? Immigrants and migrants based in the US who are sending money through nonprofits back to the homeland. And what's interesting about the timing, I mean, migration and immigration issues in the US are always political and intense. But in the last year in particular, well, the last handful of years, but right now we are thought to be in a so-called migration crisis, right? That we have folks coming through on the southern border of the US, entering, I'll give one scenario or one pathway, entering into Texas, and then for political reasons, Texas public officials are busing them up north to so-called sanctuary cities who have made it a policy imperative to accept migrants, right? And some of those cities are the US, or excuse me, New York City, and New York City then is busing them up to cities like Albany, New York, which is about 2.5, 3 hours north of New York City. That happens to be where I live, and I serve on a refugee and immigrant serving nonprofit locally. And so we have received about 1,000 asylum seekers since May, which is for the town, the size of our community is a lot, and they need a lot of services. I only share this because I'm doing this incredible research about the generosity of immigrants and migrants in the US, and then the political discourse is, migrants as takers, migrants are taking things from us, are destroying our communities, right? And so that's a real tension, right? And then meanwhile, in the development studies world, migrants are going to save the development world, right? That migrants through remittances, right? So this is a very complicated context, but I guess what, I'll just share that as I'm sorting through these different narratives and then seeing these immigrants and migrants, some of which have been in the US for decades, are legal residents, others more recent, and their status is unclear, right? But they're still committed to giving back to their homeland and also giving to their immediate community of country people that are, in Chicago. Mexicans have come together and have a lot of programming to essentially provide mutual aid. So in this context where in the US, on face value, migrants are really this week are at the southern border is on the political agenda, and there's all this negative discourse around it. I'm seeing this incredible generosity of human beings, and I think that doesn't keep me, that excites me, I guess. That doesn't keep, well, the whole discourse maybe it keeps me up at night, but the idea that even in the toughest context, when my research participants are reading about the migrant crisis, are reading this negative discourse that's happening in the political realm in the US, they're still so committed and generous. And so I think that excites me about my research, and I think I'm hoping I can contribute and tell that story more to counter all these stereotypes that migrants face. I guess I'll just leave it at that. The sleeping up and sleeping at night, I don't know yet. Maybe I'll come back, but I'll just leave it at that.
Pamela, do you want to go
Sorry,
next?
that wasn't very articulate, but
No, it was great. It was great. Thank you so much.
Okay.
Pamela,
Yeah, it was really interesting to learn more about that. Very briefly, what excites me, that is that I get to make a small contribution to create more generous societies. And generous societies are societies where people care for each other and want to contribute to each other rather than take things from others. And as a sociologist, I'm trained as a sociologist, and sociologists typically study all the nasty things that happen in the world, and I get to study all the beautiful things that people do. So that's what I really am excited about every day that I work in this field. And training young scholars is one of the biggest benefits, I think, of what we do. What keeps me awake, I'm assuming, Abhishek, you mean like in terms of philanthropy research, but that doesn't keep me awake. What keeps me awake is the state of the world. It is it's madness, it's a mess, and I'm really, really concerned and worried about it. I have 2 kids I worry for their future, also in terms of climate change, but also the wars that are going on. And it's not a great state to end 2023, I think.
Thank you. Bekin Kosi, to you.
Yeah, thanks. I think for me, what is really exciting at this moment is that I think over time I've watched the landscape changing from almost no data to a lot of what is happening now. And so that's been very fascinating because we've been part of the contribution to that change. But we are also unique as CAPC. We are the first center to actually offer these kind of programs, teaching, research, and community engagement right across the continent. So I think we are still at a honeymoon phase, and so that's very much exciting. But what is also exciting is that we can see that the narrative on African philanthropy is shifting. And that's partly because of the research, but also the convenings and the narratives that we constantly hold. I think, like Pamela, we are all worried about the state of the world. But if I'm to bring it down to CAPC level, it's really the sustainability of our interventions. How long are we going to sustain this? Because as you know, even in the continent now, a lot of universities that used to be state funded, government funding has actually gone down. And so almost every university is now, out there fundraising. And for us, this is a new program. We want to make a big mark, and that means, we have to be here over a long haul. So the sustainability of our interventions is what really is a huge challenge for us. Yeah, I think I'll leave it there.
Thank you. Thank you. I think we have 5 more minutes, Jofin, if I'm not correct. If the panel,
yes.
If the participants have any questions, Swati.
Well, thank you. That was a really interesting session. Pamela, I did talk to you for a very brief while in Arnop, and I do remember you mentioning the importance of qualitative research, and we talked about the challenges of doing qualitative research. Some of what you're saying does resonate with me. The title of this conference is The Philanthropy in its Myriad Avatars, and one of the things that we want to do as a center is to capture exactly, what else are we excluding when we look at philanthropy in a very straight-jacketed manner. And there's a lot. So, like, if you look back, to the word, which is to love of humanity, and then if you take that as your analytical framework, how do you see differently? How do you look at societies, people trying to make a difference? And there's a lot to be there. I mean, we have a research fellowship program. We have got 21 incredible papers that tell us all of these wonderful ways in which people give and demonstrates, community well-being. However, it is extremely difficult to convince philanthropists in India or funders that this is a valid exercise because the theoretical framework has not shifted, and they would say that we'd want a center which is an academic center to shift the narrative, but they don't actually know what that means. So then when we're trying to shift the narrative, that's deeply uncomfortable. And I'm not even asking about challenges like perpetuating a certain kind of status quo while trying to make a difference. I mean, we all know the tensions within philanthropy. So one is that how do you actually convince your funders who want things to change but not change? What is the language that you'd use? The second problem is that because this is such a nascent field in India, that's like sometimes I'm amazed at how there's no scholarly work happening in philanthropy in India, because the income gap is huge. There are many people who give, there are many families who give. Yes, there's very little commitment to studying philanthropy. So our mandate is that we do engage with the sector, as it were, which increasingly has become the stakeholder is the for-profit intermediary sector for the non-profit, right? So they sort of become the rightful stakeholders. And we get asked, so we do, report on household giving in India, and we see 70% of giving is because of religion. And it's like, oh, that's money gone down the drain. But here's this amazing market and we found that the giving is actually as much as the CSR funding is there. Tell us how to capture this market. And not only do they not understand it's not a job, but the fact that I or a researcher cannot say that's a better endeavor, right? Giving is so deeply, personal, but also it has to do with your morality, how you look at your nation, how you look at your citizenship. And so giving for religious reason is not very different. I mean, giving to a temple or a church is also public good, right? So to tell them that A, is not a job, two, morality, right? Here's a question of morality that you're asking me to judge morality of people. So how do you get over that question? And thirdly, this is particularly for you, Begi. I was looking at your life journey as to how you actually started an academic center and how difficult it was to start an academic center. And I'm amazed that you've been able to produce PhDs because we are struggling here. We are with a university. Our mandate is to do academic research, but it is incredibly hard. So how did that journey look like? And would you have tips for people like me? So yeah, that's like my one whole bunch of questions to all of you. Please feel free to answer, whoever feels like it.
I think you asked some really interesting questions, but am I right that we're at the end of our time now or not?
So we have some time. I mean, we have 10 minutes. I mean, 5
Oh,
minutes.
okay.
But that's
Okay.
fine.
Good to
We're
know.
not
I don't
expecting.
take
I
time
mean,
from.
if there are questions, we'll take questions. But I don't see many questions except Swati's. The big ones that Swati is asked. So I think we can use that as for the rest of the time.
Yeah, I know. And Swati, it was so nice to meet you at EarnUp, the conference this summer, and talk a little bit about what the Center for Social Impact and Philanthropy is already doing to really qualitatively understand what giving looks like. And I think that is a great first step. What your questions are about talking with funders. And I think I am not the right person to ask because I am just not really good at it. I've never worked as a fundraiser, for example, as some of my colleagues have. I've always been an academic, and I continue to find it really challenging to explain to funders why they should fund the philanthropic research. And there's some good reasons why they don't like to fund philanthropic research, because we're very slow. Like, it takes years for us to produce something, while a consultancy would just do whatever they want and very quickly. But one thing that I think could help answer your question, which I found really important, is to have a network of academics in your own region. And so we started EarnUp, the European Research Network on Philanthropy, which the conference was the conference where we met in 2008, just because there were so many individual academics in Europe that were studying philanthropy or related topics, and they didn't know each other. They were not talking together. And through that network, that's now, I think, has more than 200 members, we really learned a lot from each other, but we also were able to connect with organizations like FIDEA, which is the organization of foundations in Europe. And now we've done some projects together. So I think through those networks and associations, you can really build more meaningful connections and then have that discussion and conversation between academics and funders and explain, this is what we need. And then the funders can say, yeah, but this is what we find interesting. And then you can find a way together to move forward. And I've seen this happening in Europe. And it's also pretty recent because it's only started to develop since 2008. So it's something that I think would be interesting to explore further also in your context.
Okay, should I come in? Okay, great. Yeah, so thanks. I think my story and that of CAPSI, they in many ways were inspired by an accidental encounter in my case with the field of philanthropy. So I wasn't a student of philanthropy. I was studying political science and political theory for that matter. But I happened to be in a conference where Professor Kathleen McCarthy from CUNY was presenting. And at that time, she was part of ISTR. And this was in Cape Town. So that encounter was fascinating because she was presenting something that was close to what I was studying, but I wasn't calling it philanthropy. And so, after the session, I spoke to her and she said to me, oh, actually, this is something that I help. I have a center. If you're interested, you can, apply, and the rest is history. So I actually applied, attended, the fellowship at CUNY in 2002 or 3 thereabout. And when I came back, I actually changed my PhD thesis to focusing on philanthropy. And I think that stayed with me because even after I then joined, Trust Africa as a research fellow, one of the key things that kept knocking in my head was, the need to research more on the different forms of philanthropy. And I think at that time, what was happening is that different foundations were producing different reports, but those reports were not given the attention and the respect that they deserve, because clearly, NGO reports, people would say there's no rigor, there's no peer review, etc., etc. So as a sector then, and this is an important part of this conversation, is that we then started thinking about how to do this. So the development and the establishment of CAPSing it starts with the conversations that were happening in practice, not in academia. And so a number of African foundations, including Trust Africa, that I was actually a big part of, started having these conversations. And then we started thinking about what are the other initiatives that we could put in place. So one of them was the chair on philanthropy. And when I had the opportunity to come back to Southern Africa from Senegal, I started having conversations with different universities. And this is where I think networking is important. So I went back to the people that had examined my PhD thesis. And those were Alan Fowler, Adam Habib, I think you all know them, and started having conversations with them. And finally, Adam Habib was a vice chancellor in one of the universities. Alan Fowler had just retired. I was busy running another institution. So the compromise was Alan Fowler would actually come in on a part-time basis, develop the foundational documents. Adam Habib would then offer us a political home at the university. And that's how everything really started. And the rest really is about how you then navigate the different structures within the university outside, but also within the government system in terms of accreditation, among others. But I would say that it's important to really, in many ways have an idea, and that idea is then supported by a number of development partners, donors, the academic sector, but also the philanthropy sector itself, because without the philanthropic sector itself, there's no point setting up a center like this. And we keep on, sequencing and front-loading certain elements of what we want to do. So we started with making sure we have all the accreditations done internally and externally. We then went on to do the development of the curriculum. While waiting for the approvals of the curriculum, because it takes longer, we started doing research, because we knew that once we start teaching, we will need to teach material that is relevant to our context. And so we needed to then have this research agenda front-loaded. And then later on, we started thinking, okay, so what would be the outlet for this research? We started thinking about a journal, and we have established our own journal. And now we are back to teaching, and now we are producing our own researchers and our own academics. So if you look at the center now, most of our researchers, most of our lecturers are people that have gone through our system. Because in the past, and Pamela and Susan and everyone would know, we have always had to appeal to our colleagues in the West to help us with supervision, with marking, among others. We still do that, but we know that in the next 5 to 10 years, we will have developed enough expertise from the center to actually do that kind of work. And then some of us can then retire very much early. Thank you.
Susan, do you have any comments?
No, I am fortunate I don't run a research center, but but I know that I'll just give a pitch again for iStar. I happen to serve on the board. Becky served on the board before, and iStar, the professional association, is trying to connect centers across the world more deliberately, and that's going to really kick off in January. And I think we have some participants on this call that will be doing that, which is going to be great. And so Swati, save that question for that audience too, I'm sure, because there's lots to learn from each other, and these centers are doing incredible work globally. So I'm really excited about that.
Great. I mean, we had such diverse talking points throughout the conference, and this discussion was such a great way to bring the second CSIP Research Conference to a close. Thank you, Becky Nkosi, Pamela, Susan, and Abhishek for taking out time and being with us today. We hope to engage with you again in the future. So just to close, Swati, closing remarks, and maybe, okay, there is a question, no, maybe I think someone just raised their hand unintentionally. Right, so Swati, concluding remarks and, word of thanks, and then we're good to go for a Friday evening.
Yeah, so I see that we're end of time. So I'm just going to thank all the people who sent in their abstracts, and also all the participants who attended, or the moderators. We did have people from some funding organizations also part of the conference, and we had a really mixed group. And I know that this is a very incipient discipline in India. It's just starting off. We hope that we're going to grow. We also hope this research can be made in person because there's great value in bringing these conversations to India. And I just want to thank all of the panelists. Abhishek, we've abused your generosity, but thank you. We missed Ingrid, but you're more than capable and filling her shoes. Susan, Becky, Pamela, again, thank you very much for bringing all your expertise. We hope to interact with you again a little bit more. And yes, Susan, maybe I'll see you also in January over there.
Yeah, I hope so.
Yeah. Okay. So thank you, guys. And thank you also to the team, everybody who put all of this together and still here on the Friday evening. I wish I could say drink for me, but drinks are not allowed in office. So it's going to be pizza. So thank you very much. Bye-bye, everyone.
Thanks, everyone.
Bye.
Hi, everyone. Thank you.
Bye-bye.